Good morning, and welcome to our overview, the NIC examinations for California. We're going to be doing a different order this morning. This order was sent out to the schools. We'll be doing the barber styling examination first this morning. We should be concluding around 10:30. At 10:30, we will take a break, and then we'll go ahead and start with the cosmetology, the overviews, and all those things that we do normally. But we will start just right out with the barber styling. We'll have 5-minute breaks between each of the disciplines. We'll be answering questions after each discipline. So you'll have a little bit of an opportunity to get set up and take breaks and do what you need to do in that time. But we're just going to run right through it. My name is Sean Conder. I'm the lead trainer for NIC. We also have Mr. Don Kerr here today that will be helping us with some of the overviews. But we're just going to start right into the barber styling examination. At this point, nothing has changed in this examination. You'll have a setup and client protection. Going right into it, you'll now set up the general supplies you'll use throughout your examination. You'll also set up the supplies to perform a haircut. You'll be observed for client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you've finished. The instructions will be repeated. You may begin setup. And as you'll notice, we have put these in script form. Before you send your candidates or students into the examination, it's a good idea to run them through this examination 3 or 4 times so that they're very familiar. We see a whole different candidate come out when they show up and they're prepared and they understand what the tasks are and the instructions. You can go to the DCA website for cosmetology and get that CIB downloaded. I would suggest that you do those today. Make sure that you have fresh CIBs downloaded so that you have the current information. Every time you send a candidate to the barber exam, please make sure that you download a fresh CIB off the website and work off those CIBs. But they will set up their general supplies, which are their bags. They need 3 containers. They need items to be disinfected. They need a soil linens and a trash container. And those do need to be marked that way. That is in the CIB. If you need to refer to that, once again, that is the trash container to be disinfected and soil linens. They'll also be setting up their disinfectant, those types of things, hand sanitizer, paper towels, anything that they might need as far as a general supply. But they will need to disinfect all their work areas completely with a product labeled in English as an EPA-registered hospital-grade disinfectant. This is probably one of the biggest issues we run into in our examinations is when labels you try to create labels, original labels. We need manufacturer labels. And in the next presentation that I'll give, post-barber, we will go over what those manufacturer labels are. So I would highly recommend after the barber exam presentation, you remain on at least for the first part of the next presentations. We will do an overview as far as the test sites and what we expect out of the candidates and so forth. So please stay tuned after the barber exam for that next section. But it will describe what they need on that disinfectant. It does have to have an EPA-registered manufacturer's label. The label has to be adhered to the bottle so that it can be read. It can't be too small to read. This is an OSHA requirement that we have these labels on there. So please make sure that you adhere to your SDS sheets and your labeling on these. Sanitizes hands prior to setting up work area. Also, that hand sanitizer needs to have a manufacturer label. Set up work areas with supplies labeled in English. So all the general supplies that you set out, universal supplies, do have labeling in English. We also ask them to set up for the haircut. So they're going to be setting up those supplies as well. But they're going to set up the implements that are visibly clean and sanitary, so everything they're setting up is clean. They need to use an X strip or towel and apply a drape for that haircut. So their draping needs to be done in this setup as well. Practice infection control procedures safely throughout the setup. Maintain work area in a safe manner throughout the setup. items to be disinfected, soil, linens, and trash are disposed of in a correct manner throughout this section. So we want to make sure that as far as infection control, any cross-contamination between hair and skin, we need to eliminate that. So if I touch my hair, I need to sanitize before I touch that mannequin's hair. If I touch my skin, I need to sanitize my hands before I touch that mannequin. So make sure that if you touch the mannequin, you have to remember those hands belong to that mannequin. I need to sanitize before I touch my own hair or my own skin. And then once again, after I touch my own hair and my own skin, I do need to go ahead and sanitize before I touch the mannequin or the client again. And those are very important in today's society with all the bacteria and things that are going on. And we'll explain that as well in the next section. But we also need to maintain our work area in a safe manner. And what that actually means is that we're keeping things cleaned up off the floor. Anything that's spilled needs to be cleaned up immediately. Anything I drop, cotton rounds, neck strips, anything like that, need to be picked up immediately. We can't leave anything on the floor. No combs, no brushes, anything. So if you drop something on the floor, stop what you're doing, pick it up, dispose of it properly, sanitize your hands, get a clean one, and go back to work. Practical examinations are about what happens and how a candidate deals with them. The worst thing you can do in an examination setting is to ignore something that's happened. In other words, if I drop a comb on the floor, I'm not going to ignore that comb. I'm just going to bend over, pick it up, put it in items to be disinfected, sanitize my hands, get a clean comb, and go back to work. And that's how I would handle that properly. As long as things are handled properly, you're not going to miss points for those tasks. So make sure that you're not just moving on and ignoring the situation that happened. Deal with it the best you can, and go forth with the rest of the section. That's what you need to do to get accurate, or to get your points accumulated in these sections. Also, the items to be disinfected, soil, linens, and trash are disposed of in a correct manner throughout the section. This is about where I put things. So if I drop a comb or I need to dispose of a comb, I put it in the disinfected. If I need to replace draping, or I have a dirty towel, steam towel, it needs to go into soiled linens. And if I have trash, an old neck strip or something that fell on the floor, I'm going to throw it in the trash. So that task line for your information is all about where I'm going to put something when I'm finished with it. You will have the scripting that we use at the end of the sections. So all candidates have indicated they've completed this section. That's when all candidates have stepped back indicating they have finished, or the examiner will say, please stop working. Once they ask you to stop working, please step back. Just leave everything where it is. Don't worry about cleaning up. Just step back and wait for further instructions. This is an example of maybe a setup in an exam situation. There are a few little issues I'd like to talk to you about. The first one is taping the bag to the table. We're getting away from that old adage of taping a bag to the table. Please put your bags on the floor. They can remain open. They do need liners, but maybe a grocery sack works very well, a paper sack with a liner in it, that sort of thing. But make sure that they're on the floor, they're not taped to the table. If you do have an items to be disinfected, as that blue container is, the blue lidded container, it's marked to be disinfected. That is a proper container, but it does need to be covered if it's sitting up on the station. So make sure in these exams that you're bringing all three containers, and none of them are going to attach to the table. Also, the clippers, not necessarily the trimmers, but the clippers in this situation do not have a cord. If you do bring cordless clippers, you'll need to simulate a cord that's 4 feet or longer. So you could take an old, maybe the charging cord, and just plug it into the charging port and let it hang. That's fine. You could tape a string to that pair of clippers. We do evaluate the cord, so it does need to have a cord on them. But the kit needs to be closed. The draping can't touch the skin of the neck. We see our wipes, our disinfectant. You can have a roll of paper towels on the station. Those are a supply. They don't need to be each marked paper towel. We allow supplies not to be marked. But anything that contains something like that water bottle, it does need to be marked with a label. The disinfectant, as you see, has a manufacturer label. The hand sanitizer, you can kind of see that down there in the corner, also has the manufacturer label on it. You'll now perform the haircut section of this examination. You will complete a tapered haircut using clippers with and without guards and shears. You will be expected to complete and blend the haircut. Do not clean up the hair until you are instructed to do so. You'll be observed for client protection, safety, and infection control procedures. You'll have 30 minutes to complete this section. You'll be informed when you have 15 minutes remaining. Step back to indicate you've finished. The instructions will be repeated. We will repeat instructions twice, and then we will ask the candidates to begin. They do have 30 minutes for this section. Anytime a candidate walks up to the table to start a service, I would make sure that they sanitize their hands. Sanitize your hands prior to starting the haircut. You're going to use clipper and comb without guard to perform a tapered haircut below the occipital bone or in the nape area with no block line. I think one of the biggest problems we see in the examinations is that candidates aren't tapering. You need to start this haircut at 0. It can't be blocked at the nape. They start at 0, they then start to incorporate the comb and taper the haircut up to the occipital bone. So make sure that they don't block that nape area. They'll then use clippers with guard to perform a tapered haircut from the front of the ear to the parietal ridge. So from the front of the ear back to where they started in the nape area, that they do use guards in that area. They can use plastic guards or interchangeable blades. Either one do the same thing, but they will be cutting that very small area and tapering it with the guards or interchangeable blades. They use comb and shears to perform a haircut above the parietal ridge and on top of the head, so the rest of their haircut is done with shear work. They would need to take that weight line out with either clipper or comb or shears and a comb. They're going to establish an outline around the ears and sides of neck that follows the natural hairline. So that means I can't shave the sides bald either. I need to leave a sideburn so that the examiners can see the taper first off, but they can also grade the length of the sideburn, make sure they're even. But they do need to establish that outline around the ears and sides of neck, and that is blocked, but they do not block that nape area. They're going to be handling the shears safely at all times. That means when I'm sectioning, I'm holding my tools, I'm pointing the shears away from the head, my shear tips are closed, I'm palming the shears. We use all of our safety procedures when we're using our shears. If I do cut myself with my shears during the haircut, it's very important that I don't just ignore that. I stop, set everything down, make sure that I do a blood exposure procedure. Once that blood exposure procedure is completed and I have a glove or a finger caught on my hand, then I can just sanitize my glove and hand and go back to work. I'm good to go. It's not what happens, it's how I deal with it. They also need to handle the clipper safely at all times. That's about controlling the cord, not wrapping around the neck. If I cut myself again, I'm going to go ahead and do a blood exposure procedure. But we need to make sure that we're handling clippers safely at all times as well. Once all the candidates have stepped back or the timing has elapsed, we will stop the examination. The examiner will approach a candidate, and one-on-one they will ask them to may I please use your comb to check your haircut. So they will check each haircut individually. What they'll be checking for is the hair in front of the ear or the sideburns is uniform in length. If I shave that bald, I'm going to lose points for not having even sideburns. They need to blend that haircut evenly without a weight line. So they need to make sure they take that weight line out. Like I said, the weight line they can take out with either clipper over comb or comb and shears. They also need to cut at least a ½ inch of hair throughout this haircut. The examiners do look and make sure that they've established a haircut, a complete haircut, on the entire head, cutting at least a ½ inch of hair. The candidate will then be asked to please clean up their hair at this time. There are brooms on site and dustpans. They'll be able to go over, take the broom and dustpan, clean up their hair, clean off their cape. Don't remove the cape, just clean it off. Clean off their work area and make sure that all their work areas are cleaned up. They'll then be examined that they removed all hair clippings from the skin drape and work area and the floor is clean. We need to maintain that neck strip or talon drape for protection throughout the service. Make sure that when you're teaching neck strip, you're teaching the wrap of the neck strip, We've been seeing in some states that they're doing the traditional tying of the neck strip. Tying of the neck strip allows the cape to touch the skin of the neck, and they will have a problem with their draping portion of the examination if they're tying the neck strip. So make sure that they're maintaining that neck strip or towel, it's not touching the skin, and so forth throughout that service. Make sure they're leaving the drape on. They don't take the drape off at this point. Practice infection control procedures safely throughout the service, and we talked about that. You know, if I contaminate my work area, I definitely need to re-disinfect, but if I don't contaminate my work area through this exam, I would never have to disinfect that counter unless I have an issue. I sneeze on it or my hair touches it or something like that, I would need to re-disinfect. But we only have one client in this examination, so there is no client change. The disinfection happens in the original setup as we went through, and they wouldn't need to disinfect again. Maintains work area in a safe manner throughout the service. Again, if I drop something, spill something, leave something open, I'm going to have an issue here unless I clean it up, cover it up, and take care of it the way it's supposed to be taken care of. Items to be disinfected, soil, linens, and trash are disposed of in a correct manner throughout the section. So as I dispose of things, combs, those types of things, I'm putting them in the right container. Never do I put anything back inside of my kit. Once something comes out of my supply kit, it needs to stay out, it needs to be maintained, and it needs to be disposed of in a proper manner. So make sure I'm only taking out what I need. We don't use the shelves in the exam rooms anymore. They will need to work straight out of their kits. They will only set up the supplies that they need for those sections and so forth. But once they do dispose of it, it needs to go in the proper container. The next section of the examination is shaving with a straight razor. This is an untimed section. They'll have 2 minutes to remove the supplies from their kit for the shaving with a straight razor section of this examination. Do not begin any procedures until the verbal instructions have been read and you are instructed to begin. Step back to indicate you've finished. You may begin setup. As they set up, they'll have the 2 minutes. The timing will end. This is the 2 minutes they have to transition the station from the haircut, which they've already cleaned up all the hair. They're just simply putting some things into the items to be disinfected, soil, linens, and trash that they've used, and setting up for the shave. In the setup for the shave, remember, we can't use any aerosols in the examination. So you're bringing some type of paste, shaving cream, simulated shaving cream, but nothing that's propelled with gas. And make sure you're not bringing clipper disinfectants that are aerosol. We do need to soak those clipper heads prior to disinfection, so they would go into the items to be disinfected. But as you see on this setup, the mannequin is leaning back, facing the candidate in this situation. You have some examples on your website of different ways that you can set up this shave mannequin, but the towel does go on the table. It does need to be that drape that leaves the neck open. Also on that table, I see a razor that's open. Make sure that you're leaving your razor closed anytime you're not using it. You know, after your first 5 strokes, you step back, be sure you're holding your razor in a closed position. When you set the razor on the table, make sure the razor is closed. I also see some astringent. You need some astringent, bracer, that sort of thing. But I still have all my universal supplies out. I still have my disinfectant out. I still have my hand sanitizer out. If something happens and I need disinfectant, it's right there on my station, just like in the salon or in the school. I also have my steam towels in a bag here. If the bag's on the table, the bag does need to remain closed. I can reach in and out of that bag as I need to. If those towels are just for the shave, I can just reach in and out simply and get those towels because they are unique to that client. If they're not just for that shave, you're going to use them throughout this whole examination. You do need to keep those towels covered. Here's an example of a way maybe you could perform that shave. This is an actual picture inside your test site. You will have that table off to the side. You do need to bring a tripod. Some of the tripods and mannequins, let's talk about those for just a second. Let's make sure that our mannequins aren't fresh, brand-new mannequins out of the box. We've actually worked with the hair a little bit, got it so that it's pliable, that I can perform the services on that hair without getting the combs tangled and breaking combs trying to get through it. Also make sure that your tripod's a fairly good quality tripod. We're seeing some pretty flimsy tripods coming into the sites. You are taking a competency examination, and those tripods can really cause you a lot of grief if they're not performing the way that they should perform. So as you're doing your boards in your schools and in your shops, make sure that those tripods are stable. They're not going to tip over. They're not going to collapse or break. Make sure that the candidate knows how to use that tripod. As far as the verbal instructions, you will now perform the shaving with the straight razor section of this examination. You will drape your mannequin for the shave. You will prepare the face for shaving by lathering and steaming. Please step back and indicate you are ready to demonstrate the shave. You'll be instructed individually when to remove the towel, relather, and begin the shave. Do not remove the steam towel or demonstrate any strokes until instructed. You will be observed for client protection, safety, and infection control procedures. The instructions will be repeated. We will repeat those, and you may begin. So basically what this is an express shave. What we'd like to see is the task lines performed basically the way they're here. Sets up implements that are visibly clean and sanitary. So everything I have out on my station at this point is clean. Sets up work area with supplies labeled in English. Everything on my work area has labeled in English. My shaving cream, my bracer or astringent, they both have labels either created in English or they have a manufacturer label. Also, my disinfectant and my hand sanitizers are out with the manufacturer label on them. I need to sanitize my hands to include the wrist or the forearm, depending on where I'm going to check my towels for temperature. I'm going to apply a drape across the front of the model, covering the of the neck, and apply a towel securely by tucking it into the neckband. And we did see that example earlier. You're going to place a residue towel in the shoulder area. In this case, you could also lay it on the table next to the mannequin if you choose. Lather the beard and mustache area using a circular motion with cushions of fingers evenly and safely. Make sure we're using more than one finger. Of course, in some of the tight areas like the upper lip and so forth, you will probably break down to one finger pad, but you do need to use those cushions of fingers safely. Make sure if you get shaving cream in the mouth or the eyes, you're getting it out. If you drip it on the floor, you clean it up immediately. So those are things that you want to be looking for while you're applying your shaving cream. Wring a wet steam towel thoroughly. Test the temperature of the wet steam towel on the inside of the wrist or forearm, and apply that steam towel around the face, folding ends over forehead and leaving the nostrils exposed. So that's going to be your first step in the examination. Let's make sure we go ahead and lather, then we're going to steam, and we're going to leave that towel on the face and step back. Once all candidates have stepped back, just do nothing until you get further instructions individually by that examiner. The examiner will approach one of the candidates once everyone's finished. They will ask you to please remove the steam towel, relather, and demonstrate the first 5 strokes of the shave. They remove the steam towel and lather together in a continuous motion. There's no need for repetitive wiping. They're going to be putting more shaving cream on. They're going to relather the beard and mustache area using a circular motion with cushions of fingers safely. The first stroke that they'll put down would be the freehand stroke. They'll put down a freehand stroke in area 1. Then they'll go to hold that straight razor in a correct freehand position with palm facing towards the mannequin safely while shaving. So we're evaluating their body position of the candidate. We're evaluating the candidate holding the razor properly, and we're also evaluating where that stroke is placed. You're going to be doing the freehand stroke in areas 1, 3, and 4. Your next stroke will be, of course, area 2, or stroke number 2. You're going to be using the backhand stroke in area 2. You'll hold the straight razor in a correct backhand position with the palm facing away from that mannequin safely, with the candidate standing in front of the mannequin, of course. So we've done stroke 1. We've now went to our backhand stroke in area 2. We're going to do stroke 3 and 4, and then we're going to use a reverse freehand stroke in area 5. In the reversed freehand stroke, they need to hold the straight razor in a correct reverse freehand position with palm facing towards the mannequin safely. But at this point, the candidate also needs to move to the side of the client or the mannequin or behind to perform stroke number 5 on the neck. Once they've completed all 5 strokes, we will ask them to please complete the shave at this time. The examiner will stay with that same candidate. They will watch and they will evaluate the stretching hand, making sure it's lather-free and it's not slipping on the skin. They're going to look at the stroke of the razor, making sure that the blade is at a 20 to 40% angle. They're going to perform shaving strokes with the leading point of the razor safely, so they're not healing in on the skin. They're using the razor in a proper and safe manner. They will then complete the shave. Like I said, this is an express shave. Wring the wet steam towel thoroughly, test the temperature of the wet steam towel on the inside of the wrist, and apply the steam towel to remove all residue now because the shave is completed. They will also apply the toner, astringent, bracer, and they will all the while be maintaining their drape, which means leaving it on. If it does fall on the floor, it needs to be replaced. If it falls down on the tripod, they need to fix it. Set the razor down and fix it. Sanitize their hands, go back to work. But they do need to maintain those drapes where they originally placed them. They need to practice infection control procedures safely throughout the service, maintain their work in a safe manner throughout the service. So if while distributing my shave cream on the face or lathering, I drip shave cream on the floor, I'm going to stop, set everything down, get a paper towel, clean that up, throw it in the trash. I'm going to sanitize my hands, pick up my tools, and start working again. But make sure you're cleaning things up. Water, if it drips on the floor, no matter how small, make sure you clean it up. If you drop a tool like your razor, you only brought one razor. So we get the question a lot, if I brought my razor, what can I do? The razor and shears are the only things that if you drop at this point, you can pick up, wipe down with some disinfectant, sanitize your hands, and go back to work. Anything else, combs, brushes, those types of things, they all have to be replaced with a clean one. But we can wipe down those items, we call them necessary implements, that you only bring one of. Course items to be disinfected, soil linens, and trash must be disposed of in a correct manner throughout this section. We will ask the candidate to please step back and wait for further instruction. Just step back, have them relax. They're going to go around the room and check all of the candidates' shaves one at a time. Once the assessment has been completed, we will move forward with the examination with the basic facial. That is a 10-minute section. They will have a 2-minute setup in the foreground of this section. Again, this is when they transition from the shave and they go to the facial section. So they'll be cleaning up their shave. They'll be putting out the supplies that they'll need for the basic facial. 2 minutes. If the time expires, they need to step back and listen to the instructions. Once the timing starts again, continue their setup and then move into their service. That's fine to do. But they do need to listen to those instructions very closely. Once the setup 2 minutes has expired, you will now perform the basic facial section of this examination. You'll be observed for client protection, safety, and infection control procedures. You'll have 10 minutes to complete this section. You'll be informed when you have 5 minutes remaining. Step back to indicate you've finished. The instructions will be repeated. We will repeat those and you may begin. Whenever it says that set up implements that are visibly clean and sanitary, when that examiner walks past after the setup, everything on that station needs to be clean. There's no soiled things on the station. There's no dirty razor laying there. They've cleaned things up. They've gotten rid of them in the proper container that they need to put them in. So in other words, the razor would go into items to be disinfected. All those steam towels that they use immediately go into the soil linens, so they shouldn't be sitting there. But they do need to set up the work area with supplies labeled in English once again. They're going to sanitize their hands prior to touching that client or mannequin. They're going to apply a hair drape to secure the hair off the face, so just a headband is fine. They're going to re-sanitize their hands because they have addressed the hair and so forth, so they're going to re-sanitize the hands to include the wrist because they're checking towels. Remove the cleanser from the container using infection control procedures. So let's make sure we're not touching the tips of containers. We're using spatulas. We're using disbursement mechanisms that don't contaminate that container. Any containers used in this examination are considered to be multi-use. In other words, if I'm removing cleanser from a container, that means I'm removing it from a bottle that I will be using on every client from here on out until it's empty. So I cannot contaminate that container with my fingers. I need to use spatulas. I need to not wipe the tips of those containers. And once those containers are empty, they need to go into items to be disinfected. Once I've used the cleanser, it can go into items to be disinfected. The cleanser container would never go in the trash. You need to cleanse that entire face safely. So if I get cleanser in the eyes, I get it out. I'm watching where my fingers are going, really treating this mannequin like it's a human. We're going to wring that wet steam towel thoroughly, test the temperature of the wet steam towel on the wrist, and so forth. We're going to remove the massage product from the container using infection control procedures. So now I have massage product in that multi-use container that I'm going to be using on everybody. So I need to make sure that I'm using infection control procedures there as well. I'm going to distribute that massage product over the face. I'm going to demonstrate a good barber massage while maintaining continuous contact with the skin. And then again, I'm going to wring that wet steam towel thoroughly, test the temperature on the wrist, and so forth. In conclusion of that facial, I will apply a toner or astringent or a bracer. I will use an NIC strip or towel and drape for protection all the way through that service. Up to this point, I really haven't had to, I draped for the haircut. I then moved that drape around for the shave, and now I'm going to move it back around for the facial. So you can just adjust the same drape. If it does fall on the floor, you do need to replace it. That's very, very important. It needs to have a clean drape put on, clean towel, clean neck strip, whatever you're using. But it does need to be replaced. If the entire mannequin head falls on the floor, if the tripod collapses, or maybe I'm combing through the hair and it pops up off there and falls on the floor, simply just replace the mannequin head on the stand, adjust the draping, sanitize your hands, and go back to work. Those are situations that don't normally happen, so we don't evaluate those. But again, if that draping does fall off and fall on the floor, it needs to be replaced. They do need to practice infection control procedures safely throughout the service. Maintain work area in a safe manner throughout the service. So if I drip water on the floor, I clean it up immediately. Items to be disinfected, soil, linens, and trash are disposed of in a correct manner throughout this section. Once all candidates have completed their task of the basic facial, they step back. We will stop the examination once the whole room stepped back, or if the timer goes off, we will stop. Please stop working. At that point, if they're still working, have them just simply step back. We'll go into the blow-dry styling, which is a 15-minute section. You'll have 15 minutes to remove the supplies from your kit for the blow-dry styling section of this examination. Don't begin any procedures until the verbal instructions have been read and you're instructed to begin. Step back to indicate you've finished. You may begin your setup. Again, we're going to, at the end of that 2 minutes, stop them, or if everyone's stepped back, we'll just move forward with the examination. You will now perform the blow-dry styling section of this examination. Prepare by wetting the top and one side of the head. It's very important that you do wet the hair and we do dry it. This isn't a simulated action. You will be actually drying hair. You will blow dry only the top and one side of the head, so make sure we're only drying the top and one side. You'll be observed for client protection, safety, and infection control. You'll have 15 minutes to complete this section. You'll be informed when you have 8 minutes remaining. Step back to indicate you've finished. The instructions will be repeated. And we're going to go by and make sure all the implements are visibly clean and sanitary. They're going to make sure that you sanitize your hands prior to starting that task. You're going to use a neck strip or towel and drape throughout that service. Direct that airflow to protect the scalp. You're going to control the hair with a brush or comb. So I can't simply use my fingers in the blow-dry section. I have to control it with a brush or a comb. I have to demonstrate drying of the hair on the top and one side of the head. I'm going to dry the hair from scalp to ends to create volume, all the while maintaining that neck strip or towel and drape for protection. practicing infection control and maintaining my work area in a safe manner throughout that service. I do need to dispose of things properly again. Whenever I dispose of something, it needs to go into the right container. One of the things we see when you set up your sections, make sure you throw the container that you had that set up in away. One of the biggest problems is we see you or candidates reload that bag with all the dirty things when they're finished and throw them into one container, and they will miss this task if they do that. They need to just throw the trash bag or the original setup bag away and then dispose of the contents of that bag in the individual containers that they belong in when they're finished with them. We will then move into the thermal curling section. That is a 10-minute section of the examination. Again, they're going to have a 2-minute setup where they're going to take all the supplies out for their thermal curling, get rid of the supplies from the blow drying. One of the big problems that we see are the neck strips on the table. When they start up the blow dryers, they blow neck strips on the floor. Make sure that they're putting their neck strips where they're not going to blow off the table. That's very important because if something gets on the floor, of course, they have to pick it up. If they do need that neck strip at some point, they're not going to have it because it's now dirty. But they will be performing the thermal curling section of this examination. They'll form 3 curls on top of the head and 4 curls on one side of the head. You'll be observed for client protection, safety, and infection control. You'll have 10 minutes. You'll be informed when you have 5 minutes. Step back to indicate you've finished. The instructions will be repeated, and we'll move forward. We make sure that the implements and supplies are visibly clean. You need to sanitize your hands. Again, every time you step up to that table to perform a service, make sure that you're sanitizing your hands. Test the temperature of the iron prior to applying it to the hair. This is a one-time action. You're going to run a neck strip or a paper towel. That's usually what I recommend, is that you have a roll of paper towels on your station. Just simply tear off a piece of a paper towel, run it through the clip in the barrel, and that is testing your temperature. Throw that item away. We only test the temperature of the iron one time, and that's before it is applied to the hair. So once it's applied to the hair and we work through the hair, we understand that that curling iron does cool down. So testing the temperature is only necessary before the first application or the first curl. So make sure that they're running that material through that barrel of the iron and the clip. When I say that, automatically understand that we can't use a wand. We have to use an actual spring iron, electric spring iron, or electric Marcel that has a cord. So make sure that they're using those types of irons. They can't bring oven irons. They need to bring an electric Marcel or a spring iron. They're going to be subsectioning the hair the same width as the barrel of the iron. They need to make sure their subsections are no wider than 3 inches. They need to base that curl. In other words, heat that hair shaft before they wrap it down on the iron. So they do need to either feed and guide or warm the base and pull it up and roll it down, but they do need to demonstrate that they're heating the hair prior to rolling it onto the iron. Distribute the hair evenly around the iron so it's not just all bunched up, it's nice and flat across the iron. They need to form a complete curl. A complete curl is from base to ends. So make sure that we don't expect a barrel curl. A ringlet can be formed from base to ends, but make sure they are going tight against the scalp, protecting that scalp with a comb, and they're curling the hair from the base of the hair or the scalp out to the ends of the hair. But again, they do need to protect that scalp on every one of those 7 curls with a comb. Make sure it's not a heat-conducting comb. That is to protect the scalp from the heat of the iron. Form the curl so that the hair is smooth and unmarked, so they don't have shell marks and that sort of thing. The examiners are trained to watch. They are doing 7 curls. Just have them perform those the way they normally would perform them. They don't have to stand and wait and make sure the examiner sees each curl. The final result of the curl will show 7, and they will be watching them perform those curls as they perform them. So just have them go through and put in the 7 curls into the hair, 3 on top, 4 on the side. They can be on base, off base. Basing doesn't matter in this examination. They can be vertical or horizontal curls. That's also not evaluated, just as long as they do 7 curls, 3 on top, 4 on the side. You need to use that iron safely at all times. They never touch that hot barrel. We see a lot of them test the temperature by tapping the iron with their hand to see if it's hot. That would be a problem in this examination. That is a violation of a safety procedure. So they do need to check that iron with that material, and then they would never touch the barrel of the iron after that. But they do need to maintain the cord. That's why the iron needs a cord. Make sure it's not wrapping around the neck of the mannequin and so forth. So they need to use that iron safely at all times. They also have to maintain the neck strip or talon drape for protection throughout the service. When I'm thermocurling, one of the safety procedures is that I use a non-meltable cape. So make sure that the cape they're using in the thermocurling or the draping they're using is not plastic, that it won't melt. But they do need to maintain that neck strip or talon drape for protection. Practice infection control procedures safely throughout that service. Maintain their work area in a safe manner. So if I drop a comb, which happens quite frequently in thermocurling, I stop, set everything down, pick the comb up, put it in items to be disinfected, sanitize my hands, and move forward with a clean comb. Maintain my work area in a safe manner throughout the service. Items to be disinfected, soil linens, and trash are disposed of in a correct manner. One of the big questions that we get is, what do I do with my iron once I've completed the thermocurling section? I would simply unplug the iron and leave it right there on the station. Let it cool down. Once it's gotten, push it off to the side. Once it's gotten cool enough, or at the end of the examination, put it away. The iron may stay out on the station through the whole examination. So don't worry about putting it away right off the bat. Just unplug it, let it cool. If at some point you see it's cool and you want to put it in items to be disinfected, you're more than welcome to, but it can stay on the station. In the chemical waving, they'll have 2 minutes to remove the supplies from their kit for the chemical waving section of the examination. Do not begin any procedures until the verbal instructions have been read and you're instructed to begin. Step back to indicate you finished. We're going to repeat that, and we're going to go for the 2-minute setup. We do want to make sure that the things on the table are labeled. You do see that little bag of gloves is labeled gloves. That is unnecessary. Any supply does not need a label. If it contains something like the protective cream you see over on the other side of the screen, or the neutralizing or the saturation fluid, those do need to be labeled, but they can just be labeled with a homemade label. But they do need to actually contain product. I would not recommend that you send the saturation bottle. Don't send a toner bottle. Make sure you're using a real saturation bottle, maybe that you've washed out. Put water in it. Don't bring real saturation fluid, but they just perform a lot better in this portion of the exam. You also see the first aid kit out there. It's very important that they have their first aid kit out in case they cut themselves or hurt themselves. They have the first aid kit out. That does need to be marked first aid. You will now perform the chemical waving section of this examination. You will wrap the center back section of the head from crown to nape. Once you are finished, or if timing has elapsed, please step back for instructions to demonstrate saturation and a test curl. You'll be instructed to demonstrate saturation. You'll be instructed to demonstrate a test curl. Do not remove the perm rods until the examiner instructs you to remove them. You'll be observed for client protection, safety, infection control procedures. You'll have 20 minutes to complete this section. You'll be informed when you have 10 minutes remaining. Step back to indicate you finished. The instructions will be repeated. We will repeat those instructions, and then they may begin. All those implements are visibly clean and sanitary. So those permanent waving rods that they bring out don't have hair in the rubber bands. They're clean, ready to go for a service. They set up the work areas with supplies labeled in English and sanitize their hands prior to touching that mannequin or subsectioning the hair. They're going to subsection the hair straight and evenly. We understand these are mannequin heads. Get them as straight and evenly as possible. We don't require a 9 section or any type of specific sectioning. Just make that back panel and wrap the back panel. They're going to subsection that hair no longer than the length of the rod. The subsections are the width of the rod. They're going to wrap that hair evenly and smoothly around the rod. Distribute that hair evenly across the end paper, so they do need to use end papers. Extend end papers beyond the hair ends as to eliminate the fish hooking. So they do need to bring those end papers past the hair ends place the bands correctly. They're going to use the same rod base placement throughout the section. So if they start on base, they stay on base. If they start off base, they stay off base. If they're doing on-off base, they continue with the pattern, whatever pattern they're using, they continue with that pattern. One of the biggest mistakes we see in this section is they'll start rolling on base. They get towards the bottom of the scalp. They get a little nervous about the time, I guess, or they just are running out of rods, but they start wrapping off base in very thick sections. So make sure that they're rolling consistently. They can move the mannequin head all they want, so they can tip that head forward so that they can get to those last 3 rods and roll them on base with the rest of them. They need to wrap that hair around the rod at least 1.5 times. I would highly recommend they wrap it more than that because they need to do a test curl and then wrap it 1.5 times. We don't want the rod to fall out of the head, so make sure they're wrapping them at a minimum of 2.5 times, which the book has now changed to again. These are maybe some good examples. We want to make sure that when we view it from the side that it makes a nice formation, that we don't have loose and tight rods, that all the rods are nice and organized on the head. Once they've all completed their wrap, again, they're going to step back, or we're going to have the timing elapse, and they're going to stop that timing. They do need to continue to work throughout the timing. Get as many rods in the head as they can. They really need to complete that back wrap, so make sure that they're becoming proficient in wrapping those rods. But they do need to demonstrate saturation. The examiner will come around one-on-one. They will ask the candidate to please demonstrate saturation. They'll need to apply cotton and or protective cream, at least at the nape. So, as they apply that cotton, it can either go around the section or it can go underneath the section. They can put protective cream at least at the bottom of that rod, or they can put the bottom rod, or they could put it around the entire head would be fine as well. But they do need to apply one or the other of those. They need to wear gloves during the application of the simulated product. The simulated product, they're going to apply that across the rod, the length of all the rods in the head. I would make very sure that they're not putting cotton between the rods. That's putting undue stress on the hair. They would wrap that section in cotton or hold a towel underneath would be fine. But blotting or putting in the cotton between the rods does cause some issues. So just do as you were taught. Saturate the rods. Another problem is when you're putting the rods in, they're getting the hair saturated at that point, so that when they go to the saturation process, the hair's already so wet that it just drips off. So make sure that they're just barely wetting the hair so that it will perform in the saturation, just like an actual permanent waving. But they do need to demonstrate that saturation process. Once that's completed, the examiner will ask them to please demonstrate a test curl. They will need to unwrap that rod at least 1.5 turns, hold the hair to relax, and wrap the rod back to the head for neutralizing. So, with that being said, we're having a lot of candidates that just pull the rods out and they don't replace them. If they pull the rod out, or if the rod happens to fall out, they do need to get a clean paper, rewrap the rod, put it tight to the head, and they have recovered. So make sure that they're doing an actual test curl. They'll then be asked to step back and not remove any perm rods until instructed to do so. Have them step back, not worry about the rods in the head. They'll have a little time afterwards to take those out. Just step back, and they're going to go ahead and go around the room, and they're going to check all the rest of the wraps and make sure that the test curl and the saturation is performed with each candidate. They will have a 5-minute section where they'll take out those rods. Where they'll be given an opportunity to do that. But they do need to maintain the neck strip or towel and drape for protection throughout the service. In a chemical wave, I cannot use a neck strip. I need to use a towel under the drape to catch any of the fluid that's rolling down the skin. So I do need to use a towel in this section of the examination for the cape. Practices infection control procedures safely throughout the service and maintains work in a safe manner throughout the service. So if in the saturation I do drip water on the floor, I stop, clean it up, throw that away, sanitize my hands, go back to my saturation. We have seen a lot of the candidates putting a towel on the floor to catch any water that drips. That is a safety hazard. They could trip on that towel. They do need to keep the towels up off the floor, saturate the hair in a manner, or hold a towel in a manner that it doesn't impede or fall on the floor. At this point, they do need to throw all of their used items into the trash, items to be disinfected, or soiled linen bags. They'll then be asked as a group. So that's why I said leave the rods in the head. We're still having some people that step forward and take them out, but make sure they just step back after they've saturated and test curled. The examiner will take some rods out of the head. They need to dispose of those properly, but they will be told as a group to please remove all rods from the head and brush the hair straight back. So they are given time to take that out. After all the checking is done, then the examiner will step back and ask them to remove all the rods. So they'll do that as a group. We then go into the hair lightening and hair color retouch section. That's a 20-minute section, but they will administer this in two 10-minute segments. They'll have 2 minutes to remove the supplies from their kit for their hair lightening and hair color retouch section of this examination. You may begin sectioning the head into 4 equal sections. We do allow them to, once they've set up, to begin sectioning. Don't bring these mannequin heads already sectioned. They need to section at the examination, but they can start in the 2-minute setup. Do not begin any procedures until the verbal instructions have been read and you're instructed to begin. Step back to indicate you finished. We will repeat those, and you'll move on with your 2-minute setup. This is a possible 2-minute setup. The one thing that we see a lot in these examinations is that they're bringing a bottle of cholesterol thinking they need to transfer them into color bowls. They do not need to transfer the cholesterol into a color bowl. They can bring pre-made color bowls, and I would highly recommend they bring a little sealed container that they can use a brush in, or a container to distribute it. But just bring one that's labeled color, bring one that's labeled lightener, and bring one that's labeled with relaxer. And then they can use those color bowls, in essence, throughout the rest of this examination, and they have a lot less drama tearing off stickers and that sort of thing. Transferring product is not necessary again. Just go ahead and bring 3 containers, just small sealable containers that they have enough product in to do the sections that they need to do. You will now perform the virgin hair lightening application section of this examination. You will be observed for client protection, safety, and infection control procedures. You will have 10 minutes to complete the virgin hair lightening section. You'll be informed when you have 5 minutes remaining. Upon completion, you will step back until instructed to apply the hair color retouch. You'll have 10 minutes to complete the hair color retouch. You'll be informed when you have 5 minutes remaining. Step back to indicate you finished. The instructions will be repeated. We will repeat them, and they may begin. They set up the work area with supplies labeled in English. Sets up implements that are visibly clean and sanitary. Sanitizes hands prior to performing the predisposition test. Again, the only part of this of these tasks they can begin in the 2-minute setup would be that sectioning. They do need to perform the predisposition test in the lightening section. That's where actually where it's listed in the examination. If they do it in any portion other than that, they will not get credit. So make sure they're doing it in the lightening section. But they do need to sanitize their hands prior to performing that test. They're going to perform a predisposition test with simulated hair color behind the ear of the mannequin. If you've sent them with 3 bowls, 1 marked color, they can simply open up the bowl marked color, put a Q-tip in that bowl or a cotton swab, swab it behind the ear, throw that swab away, seal that container back up, and they can use it again in the color section. So that's probably the easiest way to do it. Do not send a small capped container that says PD test on it. They will miss their labeling. That is not PD test inside that container. That is aniline derivative color. So they need to mark it with color. That's why I'm saying it would be much easier if you just use the color bowl. They take the lid off. It's marked color. They can go ahead and wipe the skin down, apply that color to the back behind the ear, throw that swab away or whatever they applied it with, cover the color bowl back up, and they've completed that section or that task in that section. But they do need to, at some point, divide the head into 4 equal sections. They can do it in the preliminary setup of the 2 minutes if they have time. They can continue the section they had once the timing goes into play, but they do need to create 4 sections or 4 quadrants. They're going to apply protective cream around the hairline. Wear gloves during the application of simulated lightener and hair color products. So again, we do need to apply a protective cream when using a lightener. They either need to apply that protective cream around the head again. If they did it in chemical waving, they'll do it again here. But they will need to at least apply that around the section that they're working on. They need to wear gloves during the application of simulated lightener and hair color products. They will subsection the hair a 1/4 inch wide or less. Apply simulated product a 1/2 inch from the scalp. They'll apply the simulated product up to, but not including that last inch of the hair. So they will need to cover that entire midshaft with simulated product. That would be 1/2 inch from the scalp, up to, but not including the last 1 inch of hair. If they pull it through the ends, they will not get credit for that. Once they've completed that section, and they should complete that whole section, so they're going to do the predisposition, do their sectioning, and do the lightener section, all in that 10-minute segment. They will be told to stop working, or they will be proceeding with the examination once everyone's stepped back. You'll have 10 minutes to complete the hair color retouch section. You'll be informed when you have 5 minutes remaining. You may begin. So off they go with the hair color. They use their lightener bowl. They just cover that lightener bowl up, pull that color bowl back out that they used in the predisposition test, and they can go ahead and start doing their application of hair color retouch. At some point in the process, they do need to outline, depending on how you teach them to outline, but they do need to outline in the retouch. They need to subsection the hair a 1/2 inch wide or less, apply simulated product on the scalp out 2 inches, completely cover new growth with simulated product. So it's a 2-inch retouch. We only go from the scalp out 2 inches. If they have 6 feet of hair, they're still going to only go out 2 inches. It's a retouch process. All the while doing the lightener and the color process, they keep the perimeter skin free of product. If they do get product on the skin, they need to get it off. Tear off a paper towel, clean it off the skin, throw the paper towel in the trash. But they do need to get it off the skin. At no point can there ever be any of this product on the skin. So once they've completed the section, they usually will flip the hair down. Make sure they check the neck after they flip the hair down for product. If there's product on it, clean it off. Maintains neck strip or towel and drape for protection throughout the service. Practices the infection control procedures safely. Maintains that work area. So in other words, if I drop a color brush, I have 2 issues. I have color on the floor and I have a brush on the floor. So I need to pick the brush up, put it into my items to be disinfected. Then I need to get a paper towel and I need to clean up that product that's on the floor and put that paper towel in the trash. But I do need to maintain my work area. It's my responsibility if something's on the floor to clean it up or pick it up. Items to be disinfected, soil linens, and trash are disposed of in a correct manner throughout the service. We will go into the chemical relaxing section next. We're going to do a virgin application and a retouch. That is 20 minutes in 2 10-minute segments. You have 2 minutes to remove the supplies from your kit for the chemical relaxing section of this examination. Do not begin any procedures until the verbal instructions have been read and you're instructed to begin. Step back to indicate you've finished. You may begin setup. Once the setup's completed, let me go back. Once the setup's completed, you will now perform the chemical relaxing section of this examination. You'll be observed for client protection, safety, and infection control procedures. You will have 10 minutes to complete the virgin relaxer section. You'll be informed when you have 5 minutes remaining. Upon completion, you will step back until instructed to apply the relaxer retouch section. You'll have 10 minutes to complete the relaxer retouch. You'll be informed when you have 5 minutes remaining. Step back to indicate that you've finished. Instructions will be repeated. You may begin. They're going to be setting up their supplies labeled in English. Implements are visibly clean and sanitary. So at this point, everything on that table needs to be clean. I need clean brushes out, I need a clean bowl out that says Lightner on it. All my other bowls are capped and put away. Nothing ever goes back in the kit, remember that. Not blow dryers, not curling irons. They need to go into items, be disinfected, or just be maintained on the station. They need to sanitize their hands prior to applying that protective cream. Again, they need to provide that protective cream around the hairline. Wears gloves during application of simulated product. In the demonstration of the Virgin Relaxer, they'll subsection the hair a 1/4 inch wide or less. Apply simulated product 1/2 inch from the scalp. Apply simulated product up to but not including the last inch of the hair. They're going to completely cover the mid shaft with simulated product. And then we're going to go into our next 10-minute section, which is the relaxer retouch section. You'll be informed when you have 5 minutes remaining. You may begin. The subsection of hair a 1/4 inch wide or less. Apply simulated product starting slightly off the scalp, up to a 1/4 inch from the scalp, and out 2 inches. Completely cover that new growth with simulated product. And once they've finished that section, they're going to step back as well. So the relaxer's in 2 sections, each one 10 minutes. Once I finish my first section, I'm going to step back and wait for further instructions, and then they're going to ask me to go ahead and do the second section, which is the retouch. After the retouch section, the examiners will come to each candidate and ask them to please demonstrate smoothing of the relaxer retouch product. They do need to demonstrate smoothing of subsection in direction of hair growth and cuticle with moderate tension. The things that we see wrong in this portion of the exam is they'll go back and forth on this shaft of the hair. This asks them to go in the direction of the growth and the cuticle. So they do need to pull back from the scalp. They do need to do the ends, so make sure they're pulling that product clear through the ends. That's very important. They're going to keep that perimeter skin free of product, so if they do get it on the skin, they get it off immediately. Throw the towel away. Maintain neck strip or towel and drape for protection throughout the service. They're going to practice infection control procedures safely throughout the service, maintain their work area in a safe manner throughout the service, and then dispose of their supplies that they've used into a container. We never put anything back in the kit. Please remember that. Big mistakes that happen in those examinations are putting things back in the kit, reusing some different things that they shouldn't be reusing. You can ask questions or email questions to nictrainers@gmail.com. I would limit this, please, to you instructors and school owners. Please do not give this out to your students. We will answer school questions. You can also go to your DCA website. During this telecast or this webcast, you can email your questions. We will answer them as we go through the webcast to nancy.harlow@dca.ca.gov. Once again, if you have email questions that you would like to ask me or Don while we're doing these presentations, please feel free to email them. We will answer you. nancy.harlow@dca.ca.gov. That concludes the barber portion of this presentation. We will go off air while we collect your questions. I'll come back. I'll answer your questions at about 10:30. And then we will proceed with the other examinations after that point. So we will come back at 10:30 and answer the barber questions. After the barber questions have been answered, we'll continue on with our telecast or our webcast. But I would really advise you to listen to the next section that I present. That's kind of the general instructions and the testing instructions and what NIC is, what we expect out of the candidates, what they can and can't wear, how they maintain their kits, and so forth. So the next section is very important to listen to. I would invite you to stay and listen to that section, but we will be back at 10:30 to answer your questions. Thank you. Welcome back. We did have a couple of questions. I do want to remind you about the shelves again. In the examination rooms, there are shelves in the up above the workstations. In past examinations, you have been able to use those shelves, but in future examinations from now on, those shelves will be out of play. They will be blocked off so you can't use them. You'll need to actually Work out of your supply kit that's underneath the station. Be sure and tuck those 3 containers or 2 containers or however many containers you have on the floor. Be sure that you're putting them up underneath the station so that you're not tripping on them and so forth. But you are not able to use those shelves anymore. One of the other questions I got, apparently there's a YouTube video. We don't endorse any of the YouTube videos other than our own. So when they're doing the color section or the relaxer section, if they choose to put a towel down onto the uncolored section and they're flipping the sections over on top of that paper towel, that's a technique. We don't evaluate that. We just simply evaluate them doing the one section and each quadrant. We would prefer that they start at one side or the other on the quadrants. So we're going to start the lightener here, do the color retouch, do the virgin relaxer, do the relaxer retouch, or work around the head the other direction. But we do not require them to put a towel as a barrier between the uncolored hair and the colored hair, the unrelaxed hair or the relaxed hair. So that is strictly technique. We always ask them to do as they were taught. If you do teach them to do that, they're welcome to do it, but we do not evaluate that. Also, the question came up about use of a conventional razor. The section requires in shaving this, requires a straight razor. So you can use a straight razor that uses disposable blades, or you can use a conventional strop type straight razor. We do not allow at all disposable razors and personal razors of any kind. So if you have that nice 5-blade razor that you use, we do not allow that. It has to be a straight razor. And that's really all the questions that we got during that portion of the exam presentation. We do invite you to send your questions by email to nancy.harlow, Harlow, at dca.ca.gov. Basically, what I'm going to go through now is about NIC and how NIC works, a little bit, how the test is developed, why we do the things that we do. It really helps an instructor, and both Don and I have owned schools and been instructors, but it really helps the instructor to listen to this part of the program, puts a little reasoning behind some things. We also give you some tools to use for your candidates that help them, not only with the examination, but of course with their career. We always want them to be highly successful. The one thing that we need to understand about this examination is it is a competency examination. We are evaluating competency. We have a minimally competent candidate come into the examination room and hopefully pass the examination and become competent and licensed. So we do expect these candidates to perform these tasks with competency. And we'll talk about the necessity of that in a few minutes in this presentation. But I just wanted to throw that out there and make it sure that everyone understands that what this examination does is take them from a student to a professional. And so they do need to be able to perform these tasks as a professional with minimum competency. The national examination, let's talk a little bit about NIC and the examination. NIC is, NIC is not the examination. The National Interstate Council of State Boards of Cosmetology is a organization of state boards. And so we'll kind of talk about how that comes about and what they do with their information. But this training material is also protected by copyright, so it's not allowed to be recorded. You can go on your DCA website and find a link to find these videos and watch them again. We also have a video available for sale on the NIC website at nictesting.org. We also have CIBs available on that site. Any updated examinations you'll find on the front page. There's a blue button that says Updated 2016. Those are the exams that you will be using here in California in their raw sense. You do need, when you go there, you'll see that the CIBs are set up a little differently. And on that web page, when you click into that blue button on the front page, you'll find that the cosmetology critical or CIBs are delivered in a different manner. You'll download the core section, which is the services 1 through 10. The core sections are services that all states are required to use. You will then download Section 14 and Section 20, which are your additional sections. You do need to come prepared to do both those sections as well. Chances are you may not perform both. You may be required to perform both, but you do have two different examination processes, so you will need to bring supplies for the basic facial and the sculptured nail as well for the cosmetology. But you'll see those are set up a little bit differently. It's a lot less printing. You save a tree or two, so we prefer to do it that way. I think it is a lot easier for you as well because you don't have to download all those sections that you don't take. But the National Interstate Council of State Boards of Cosmetology is a not-for-profit corporation, again, comprised of each regulatory entity and their administrative staffs. The mission of the council is to promote the protection of the health, safety, and welfare of the public and the professional workforce by actively pursuing excellence in cosmetology and its related fields. We offer the standardized, valid, and legally defensible national examination. This examination is available in most all states, but as we write these examinations, we adhere to best practices, recognize accreditation standards. The entire test development process that we use, from the practice analysis, which very soon the barber analysis will be out, and we'll talk about that in a moment. The barber is in rewrite at the current time. But from the inception of that analysis to the reporting of candidate scores, we ensure that examinations that we produce are reliable and valid tools for assessing minimum competency. And remember, I just said minimum competency is what they walk in with. Hopefully they walk out being a professional or a licensed professional. Each step of the process is the link of the validity chain. It provides defensibility for our examination. We do write them according to ANSI and other globally accepted test development guidelines. So the actual examination is very well written. The scope of the national practical examination includes core domain services. Those come from the job analysis. Like I said, we are in development for barber at the current time. Within the next 60 days, you should see on the NIC testing website these surveys for licensed barbers to take, so you can give your input on what you think barbers entering the field should be graded on and assessed on, and what they shouldn't. So it's very important that licensed barbers go on that website in about 60 days and take that survey. We take that information, and that's how we write our examinations. We don't trade around any information. We take what you give us, and we write examinations around those parameters. But we do believe in a solid commitment to maintain high standards that you and I have established in this industry. We have brought this industry up. We've brought it to a real respectable point at this juncture in time. We believe that in most examination formats in the past, a candidate could possibly achieve a passing score simply by learning and following tasks. I don't think any of you will disagree with me that you could take an old CIB and look at the tasks and maybe perform those tasks without any education. As I said, this is a competency exam. We believe that services performed in this manner are not defensible in a licensure arena. In other words, if our licenses are challenged by our legislatures and so forth, we don't believe that that type of testing would really show competency on our part to be able to maintain licensure. So the National Examination Program are being designed with the knowledge that there's many ways to examine a skill as people there are to teach it. And if I ask you all to email in right now a certain procedure, you would all email me different ones. And so it's very important that we watch these candidates do what they learn in school rather than learn a state board haircut. So you're going to see the state board haircut go away in this examination, which I think is a phenomenal addition. But we do watch a basic skill. We need to watch some type of a skill in order to assess the candidate, but we want to watch what they learned from you, the instructor, in the manner that you, the instructor, taught them, and in the manner that they will perform it on the general public. The candidate is responsible to perform these tasks utilizing infection control procedures while maintaining a safe work environment. Now, as we saw in the barber exam, or we see in the past cosmetology exam, Each section has their own infection control and safety task lines. In the new examinations, you don't see those in there. That's because those two items are assessed in each task. So in each task, when you download your CIB, you get all the task lines. That tells you exactly what the candidate needs to do. They need to use something safely. They need to perform something this way. That's exactly what they do. But they do need to maintain their work environment safe. So if they drop something on the floor and they don't pick it up, as it says in the CIB, they could possibly fail this examination. It's very important they keep their floor clean. It's very important that if they drip water, they wipe it up. It's very important if they drop a comb to pick it up. It's omnipotent that if they cut themselves, they do a blood exposure procedure. They don't just ignore it or try to hide it. Practical examinations are not what happens. It's what happens and how they deal with it. And that is what it assesses. The infection control element is also in each task. Infection control is about cross-contaminating between my skin and hair and the client or the mannequin's skin and hair. So I want to make sure that if I need to adjust my hair, I sanitize my hands, I adjust my hair, I sanitize my hands, and I go back to the mannequin head. I have to remember whose hands these belong to, and we're going to talk about why in a moment, but I have to really remember that. The movement in the NIC national testing creates a practical examination which your candidate will display the basic service the way you taught them and scored according to their infection control knowledge to perform a task and their safety control knowledge, and they're not going to harm themselves or the public, and they do a great basic service. So those are the things that we're looking at now. That's a little bit different, a little bit uncomfortable in some ways, but I'll kind of talk to you about the new cosmetology formats, and you're really going to enjoy this examination. Our candidates are doing great at it. You know, I always said in the haircut, it's a very difficult haircut. If they could just come in and perform a haircut the way that they learned it, they would do a lot better, and they actually do. So we'll talk about that during the haircut portion. I'll try to answer any questions you have. I would like you to email your questions again to nancy.harlow@dca.ca.gov. Please wait until we go through the section. We try to answer all the questions we can, say in the thermal curling section. If you have a question about thermal curling at the end of the section, please email your question in. We'll take questions at the end of the presentation. We'll take a little break and then we'll answer questions. But it's not the responsibility, or it is the responsibility, excuse me, of NIC and a state regulatory board to ensure licensed professionals who practice on the general public will do so in a safe and sanitary manner, not to determine salon readiness or skill level. If they get out there, they're not like us. They don't go get more education. They don't really take their industry seriously, but they get out there. They can't necessarily perform the task correctly, but they do it safely and use infection control procedures. That's where licensure comes from. If they don't do a good haircut, they're never going to make it in the industry. They need to go out and get more education. They need to learn how to do those services. So we don't determine their salon readiness or skill level. That's your job as the school. But the tasks evaluated on the NIC National Practicals are the tasks listed on that candidate information bulletin that you are downloading. Make sure you download a fresh bulletin every time you send a candidate to an examination. But NIC promotes national endorsement, which is very nice. If you take the NIC examination in California, you can endorse into many states and territories. We believe in standardization of regulations affecting the practice of cosmetology. I can, for example, Utah's hours have dropped to 1,600. Wyoming's hours are dropping to 1,600. So we're seeing the hours come back into play between 1,500 and 1,600 across the board. That's very good for our industry. That's very stable for our licensure. That's the kind of things that we want to see. Those are the things that NIC really looks at and fights for, our standardization in our industry. But you can go ahead and go to your state website and download a CIB, and I would highly recommend you do that to better understand these examinations that you're viewing. Be sure and have a fresh copy all the time. This will aid you in understanding what the candidate's tasked and how they need to perform them. But you can also visit the official NIC webpage for practice examinations to better prepare your candidates for those written examinations. We do have a piece on our site now where they can go and take practice written examinations. So that's at nictesting.org. NIC examinations are always administered in a testing environment. Candidates are evaluated at all times. Candidates must follow all appropriate public protection and infection control procedures during all phases of the practical examination. So when we say they're delivered in a testing environment doesn't allow talking, it doesn't allow them to communicate back and forth to one another. One thing that we always hear is that the examiner was mean. Our examiners are only able to make two statements to our candidates. Do the best you can with what you have available and do as you were taught. Anything outside those two statements can be viewed as helping a candidate to pass the examination. We stay away from those statements. So when your candidate raises their hand and says, you know, do I saturate all the rods? They'll be told, do as you were taught. And of course, in the chemical waving, we are taught to saturate all the rods. So they will only be told those statements, and I will review those in a moment again. But they do need to follow all those appropriate public protection and infection control procedures. So if I cut myself, I'm fixing it. I don't ignore it. Cell phones, watches, all other electronic devices are absolutely not allowed anywhere inside the examination area. That also includes purses and hats and all those types of things. We need to actually come to the examination ready to work. Don't put your cell phone in your kit. Don't turn it off and put it in your pocket. It needs to not come in the room at all. If a cell phone is discovered in the room, you will be asked to leave the room immediately. So it's very important that we don't bring cell phones into the examination. We don't wear watches and other electronic devices. If it is a life-supporting device like an insulin pump or a pacemaker, of course, we do allow you to wear those, but we're talking about things that are actually unnecessary in the examination. Printed or handwritten materials and or any type of visual aids are strictly prohibited. The things we see laundry lists on the front of bags that show them the steps the way they do them. We see cups come in the examination that say number 1, cleanser, number 2, exfoliator, number 3, massage cream. Those are cheating, basically, and those items will not be allowed in that environment. So when you label your containers, you need to label them with what's inside, cleanser, exfoliator, or that sort of thing are allowed, but you cannot number those in the steps that they do them in. Again, this is a competency examination. We expect them to be competent to use the right product at the right time. Talking, again, is not tolerated between candidates. The examiners won't talk to them, so there's no talking allowed in that testing environment. I do like to bring up these bottles. We're still seeing a few of them show up in the sites. There's no way I can touch the tip of these bottles with a bare finger and not contaminate the tips of those bottles. I would try to eliminate these from your kits, but if you do need to use them, you're required to either sanitize before you open them or use a barrier like a cotton round or a piece of paper towel to barrier your finger from the tip of that container. It's always easier, of course, to find different disbursement mechanisms like the yellow bottles are. They work much better. But all products and containers are considered to be multi-use. Products must be dispensed using infection control procedures. So in other words, when you send them with that 2-ounce container that says PD test on it, the first thing they're going to have a problem with is labeling, because inside that 2-ounce container is color, not PD test. PD test is what they're doing with it, basically cheating. So you need to make sure that that little container says color. When they're finished with that color, it is a color bowl. It goes into items to be disinfected. There are no disposable containers in the examination unless a product is transferred from one to the other, and we'll talk about that as we go through the sections. But every container is considered to be multi-use. In other words, when I bring my 2-ounce cup that says cleanser on it, that's cleanser I'm going to use on that client, and the next client, and the next client, until that container is gone. The only way that I could use that in a single-use manner is to transfer that to some other container. That's not necessary. They can use those containers just like you teach them to use them in the in the actual treatment rooms and in the salons. But all containers must be clearly labeled in English. Labels must reflect the actual product utilized for that portion and not the sequence of use or what's it used for. Manufacturer labels may be used, and it's actually a preference, but if they do make a label, they have to be in English. They can contain no other languages. Let's talk a little bit about infection control, and you can actually look this one up on the internet. But infection from makeup brush leaves young mom paralyzed. What the story behind this young lady is, she was going to the club with her friend. She's a single mother. She was going out to have a little bit of fun, got to her friend's house, had a little blemish on her face. She used her friend's makeup brush to cover that blemish. Within a few days, she developed MRSA. The only reason this young lady's in a wheelchair is because the MRSA went to her spine rather than to her brain, which would have killed her. So it's very important that we use disposable implements. I'm on a big push right now that schools, there's really no reason to have makeup brushes. We should be teaching them to use disposable implements on makeup. If we are using makeup brushes, we're using makeup brushes with plastic handles and synthetic bristles that can be disinfected, not sanitized or cleaned. You need to clean that brush and you need to soak it in disinfectant. Wooden handles of any sort cannot be disinfected at all. So make sure that they're plastic handled, they have synthetic bristles, and that they're treated like any other comb or brush, where they're cleaned with soap and water or some type of antiseptic, and then they're immersed in the disinfectant for the manufacturer's time. Very, very important. And those makeup brushes are available. Those nail brushes are available. Several different brands that have plastic handles and can be disinfected and do stay together during disinfection. But MRSA is a killer. This is a nick from a nail file. We always say that the nail techs, you know, they have a lot of problems, which they do because they're dealing with skin and nails. But by the same, on the same token, we have cosmetologists that they're missing hair in half of their head because they've scratched their head after they've touched one of their clients' heads and so forth. So MRSA is deadly. MRSA will kill you. There's also VRSA that's come about. And so we really need to watch these infections and bacterias that are being passed and take care of them in our salons. I think you'll remember the different foot spa issues that came up in California with microbacterium. And when that happened, it affected the whole country. In my salons, people didn't come in to get pedicures anymore. They were very reluctant to do that. And it took a long time for us to reestablish the industry, that pedicures were safe. So we really need to be proactive. We need to be teaching proactivity as far as these diseases and infections and bacteria go, and we need to not have them happen. But there's also HPV warts being spread in salons. There's HSVI. This was actually a wax stick that went from the genitals back into the wax pot. It was double dipped. It was then used on someone's eye, and they developed herpes of the eye or HSV of the eye. Those types of things happen quite frequently. And of course, the macrobacteriums that were in the nail salons, in the pedicure tubs, that was the bacteria that caused those problems. So the one thing we never want to see is social media with our face on it. Ladies and fellas, please take extra care when getting a pedicure. My mom's regular pedicure quit her job. So mom used someone else a few weeks ago. Now mom's in the ICU waiting to have surgery to remove all of her toes and part of her foot. These types of things happen on social media. They spread very quickly. They affect each and every one of our businesses. So let's make sure that we're teaching in our schools good infection control procedures. I do know there are several of the major disinfection companies like King Research or Barbicide, Leucocide, all have certification programs on their web pages. Send your candidates or your students at that point, first day of school, send them through one of those programs. They get a nice certificate, you know, they get a few extra little perks, and they start out in the industry correctly. When they become a senior or the second part of their program, send them through it again, get another certificate. That's a great thing to send them out in the world with, is an infection control certification. So those are some things that you can do. so that you don't end up with your name. I did block this name out on this second Facebook post, but they actually put your name, they put your locations, they know who you are. So make sure that we're not creating that environment for everyone. Original manufacturer labels are required on all disinfectants and sanitizers. You have to have a manufacturer label on your disinfectant. You have to have a manufacturer label on your sanitizer. Disinfectants must be EPA registered, which most of them are, and hospital grade. If I can buy it in a beauty supply, usually it's a hospital grade disinfectant. Look at the contact times. That's another way to tell. If the contact times are below 5 minutes, I can be pretty ensured that that's going to be some type of a hospital-grade disinfectant. But we're talking about major disinfectants in the industry like barbicide, marvicide, cavicide, Citrus 2. There's a lot of different ones if I didn't mention them. There's a lot of them out there, but if I can buy them in a beauty supply for the general rule or major beauty supply, they're going to be some hospital grade, but make sure they're bactericidal, fungicidal, and virucidal. You'll see those requirements on the CVIB as well. But they must be real product. We want them to disinfect that station when they come in with real disinfectant. Do not put water in them. Don't put Windex or window cleaner in them. Make sure that you're actually using an actual disinfectant and an actual hand sanitizer. A lot of those disinfectants, like I said, we use in salons throughout the United States and schools. They're EPA-registered hospital grade or medium-level disinfectants, virucidal, bactericidal, fungicidal. Those are the ones that we want to see used in the examination as well, and that's very important that we use those types. If I do have a bulk mix product like barbicide, I can download the label off their King Research website. This label has to be attached to the bottle that's dispersing the product, so the spray bottle. The spray bottle it's mixed in needs to be labeled. That's very important. But as you see, it has all the requirements for storage, poison control, contact times, all those different types of things, but it does need to be on that bottle in a manner that you can read it. Here's a Marvicide label. That's a good label. But then I get into the back of the label where it actually says other things and it's not clearly labeled. What this is an OSHA requirement. If a first responder needs to read this label, it needs to be in English, first of all. Second of all, it needs to contain the information that they need to see in order to take care of the emergency situation that's happened. So we need to make sure that these labels are on those bottles. I took this picture at an actual test site, and I include it because I think it's really important. You'll see up at the top of the screen there's a bag. They have a liner in it. The bag looks great, but the label on it says to be discarded. That really doesn't tell us what they're doing with those items. They're just throwing them away. I know when I took my exam, we put everything in a to be discarded bag. But now we need to know what their intention is with what they're discarding. That bag should probably say trash on it. Anything that's going to go in the garbage or the trash needs to say trash. We have the soiled implements box in the front of the screen. That soiled implement box should say items to be disinfected because that's what I'm going to do with them, not what they are. I also see a bottle of disinfectant there with simply a spray nozzle on it. That's not correct. It's not mixed to manufacturer's specifications. It needs to be mixed and put in a spray bottle and labeled on the spray bottle. I also, there's a green bag right behind that that says biohazard on it. We no longer require biohazard bags in the examination. You just simply have a blood spill, you simply have a blood exposure procedure that you need to do. That is accomplished by a first aid kit, not by any type of blood exposure kit. There's no such thing. With a blood spill, it's 20 milliliters or more on the floor. What we're dealing with is a cut. You know, I've snipped my finger or I've cut myself somehow. So we just need to simply know how to treat that injury on ourselves. And so the biohazard label is not necessary. It's not needed. The other problem with that biohazard label is it's not a proper biohazard label. If it is biohazard, it needs to have the orange label with the black contrasting writing or a red bag. So that they would have an issue with their labeling in that situation. I also see some plastic on the floor. Nothing can ever go on the floor. As I just said in the barber exam, during the saturation, we see candidates drop a towel on the floor to keep the water off the floor. That is a safety hazard. People trip over those towels. If they're concerned with dripping, they should be holding the towel underneath the rods in a proper manner, the way you teach them, not having things on the floor. We need to keep the floor clean. If there's anything on the floor, they could possibly fail the entire examination from those things being on the floor. So let's make sure that we're keeping that floor good and clean. In NIC examinations, we look at 5 different things. First of all, we look at a blood exposure procedure. We want to make sure that a candidate knows how to handle situations where blood is present. So we do have blood exposure procedures in our updated cosmetology examination, in the nail examination, and the aesthetics examination. But if there is a cut situation in the cosmetology examination during the haircut, they do need to perform a blood exposure procedure. So we'll talk about how many. I would send them with at least 4 different blood exposure procedures, supplies in their first aid kit for the cosmetology exam. But they also need to know where they dispose of items, and that's what we just kind of went over in that last slide. Items to be disinfected, soil linens, and trash. We need to know that they know what they do with an item after they've done it, or they're done with it. Storage standards. Nothing ever goes back in my drawer once I take it out. I have a drawer, it's disinfected implements and supplies. If I stick my hands in there, I need to sanitize my hands prior to putting them in there. I also can never put anything back that's contaminated inside that drawer. Think of that kit that you bring to the examination, your supply kit, as that drawer. I never put anything back in it, not a blow dryer, not a curling iron. It's not a transport mechanism at that point. It is my clean storage area during the examination. If I put something in there, I've contaminated it. So let's make sure that once something comes out, it's either used and disposed of in a proper manner or simply left on the station, and we'll talk about those types of things. In the examination rooms, you'll no longer be using the shelves. Those shelves will be basically out of play. So you will be working out of your storage kits now. We have seen that since the last telecast that they are bringing kits and working out of them. We appreciate that. But we also look at the work area maintenance. If I drop something, I have to pick it up. If I spill something, I have to clean it up, and so forth. Is my area, is there cords in the way? Am I tripping over things? That sort of thing. And infection control standards. So, do I know who these hands belong to? Once I've touched the client, my hands belong to the client. Once I touch my own hair, my hands belong to my own hair. So if I'm going to adjust my hair, I need to sanitize, adjust my hair, sanitize, and go back to the client. These are very necessary, as you've seen in those last few pictures of those bacteria that are spreading. We do have cosmetologists, like I said, that are missing half their hair because they've gotten some type of MRSA or bug inside of their scalp. MRSA grows in the hair follicles, so we need to be very careful of that. But inside the examination room, again, no electronic devices are permitted. Your examination rooms will vary. They do have flat wall stations here, so the second picture is a little more accurate as to what your stations look like. I will show you some other pictures in a little while. Some of the things that we do see in examinations as far as the bags go, we see them taped to the table. Get away from taping the bags to the table. When the client change occurs, they have to be untaped and retaped, and it's because they need to be disinfected under. If they bring bags, they can use them through the whole examination if they set them on the floor, put a liner in them. But these bags just aren't really functional for this candidate either. This type of a bag, very pretty, looks great, but by the same token, they have to touch that bag every time they have to throw it in there. Therefore, they have to sanitize every time they touch the bag. So logistically, it's a nightmare in the examination. This girl really had some issues. She has plastic on the floor, which was a big problem to begin with. She also has these bags on the floor that just don't function. She can't fit things in them. They don't work. Make sure that you're sending your candidates with proper equipment and supplies for the examination. We hate to see them fail because they didn't bring the proper equipment. We want to see them pass because they're competent. Candidates are required to bring that supply kit with sufficient quantity of clean implements, supplies, and other materials needed to complete this exam, whatever examination they might be taking. The examination supply kit must be kept closed and stored under their work area. Candidates may re-enter the kit at any time during the examination to remove any additional materials they may need. The supply kit is considered, again, that drawer or storage area during the examination, therefore part of their work area. It's not a transport mechanism at that point. It becomes their storage area. So make sure they keep it clean and don't put anything back into their kit. Again, anything removed has to be disposed of following infection control procedures and not put back. Candidates must supply, actually in your test sites, there's water at the test sites, but you're welcome to also bring your own water that you'll need to the examination. You are responsible for cleaning your area and removing the supplies that you use throughout the examination. You will need to clean those up when you're finished. Candidates are given a minimum of 10 minutes to set up universal supplies they use in those examinations. They'll be instructed when to clean up and prepare for the remaining sections. So what I would do is I would perform my haircut, I would put all my tools on the table or the counter, work area, and I would step back and wait for further instructions. In my chemical waving, I would roll that section. I would step back and wait for further instructions. Don't clean up. Don't take the rods down. Don't sweep up. Don't do anything until that examiner asks you to do it, please. The number one safety procedure that we follow in our industry, in my opinion, is following instructions. So make sure they're following the instructions given them by the examiner. Verbal instructions are always read twice for each section. Candidates are expected to continue to demonstrate all tasks in the section until such time they have completed the section or time has expired. In other words, in the updated cosmetology content, you do need to complete your tasks. There is a deduction, a small deduction, if you don't complete them. So you are expected to continue to demonstrate your haircut or your permanent waving until you have finished what you were asked to finish, you've completed your haircut, or you've completed the center back section of the head with rods, and then step back and wait. At the timer, if the timer expires and you're not finished yet, please just step back and wait for further instructions. Don't try to get another rod in or that sort of thing. Just step back and wait for further instructions. Or turn the hand in the case of the nail exam when you've completed that section. Candidates should perform all tasks in a manner that you taught them. We want to see the way you taught them. We want to see how they're going to practice on the public. So I always hear, where do I find this haircut? You'll find it in your schools. You'll find it in your textbooks. You just need to follow the criteria of the haircut. Very simple. We'll go through it. Where do I find the chemical waving? In your textbooks, in your schools. We do reference our examinations to Milady's, Pivot Point, and Click would be the three major references that they're referenced to. There's also a reference list on your DCA webpage. There's also one on the NIC website as to what references are used for these examinations. You are responsible for maintaining your work area in a safe and sanitary manner. I keep saying that over and over again. If you drop something, pick it up. Don't leave it on the floor. Immediately, set everything down, pick it up. Get a clean one if you need one. Sanitize your hands. Just follow your infection control procedures to a T. Candidates must arrive at the testing site no later than 15 minutes prior to the start time. That is my suggestion. You want to be able to be there early, get your paperwork done, get everything together, sit down and relax for a minute. Don't rush in and rush into the exam. You know, send them with plenty of time that they can sit down and breathe for a little while and just kind of meditate on the exam and relax in the environment. All items required to enter the site must be in order and presented when they're admitted, such as their photo identification, admission letters. They do need a supply kit, those types of things. It's recommended, and I put this very nicely, that candidates arrive at the examination site dressed in a manner that will not inhibit nor distract from their examination experience. The way I always explain that is they're not going to the prom and they're not going to bed, they're going to work. So make sure they're dressed to work, their hair's controlled. Hair is one of the biggest killers in this exam, as well as charm bracelets. Leave the jewelry home, go to work. You know, you want to tie that hair back and keep it out of your your work area, and so forth. So make sure that those things are happening. The mannequins and supplies used in the examination, another big problem. They need to arrive clean and without odor. We get a lot of stinky heads used for the hair services. So please make sure that those, when they prepare those heads, that they smell good, they're not spoiled, they don't have the sour smell to them. It's very distracting to other candidates. Also, never bring a new head fresh out of the box. Make sure that hair's been beat up a little bit, trimmed down to where they can do the services, and that sort of thing. But, you know, I understand that we all have our financial restraints, but this is my examination that I'm taking to perform my career for the rest of my life. Hopefully, I would want to invest in a mannequin head that would be very beneficial in this situation, rather than one that's maybe a little bit on the difficult side to perform on. So I think I would probably make a little investment in my career and invest in some decent equipment to use in this examination. That's just my recommendation, of course, but that is an observation that we do see. They'll bring a head that the hair, just came out of a box. They can't even put a comb through the hair. We actually had one of your California examiners try to check a haircut and break the comb the other day. So, we need to be very sure that that hair is manageable. They are also responsible to familiarize themselves with their kit, their equipment and supplies before taking that examination. I saw a situation the other day where a gal took some supplies out of her kit. She raised her hand. Of course, we can't help her. She said, I don't have any disinfectant. And of course, she was told, do the best you can with what you have available. She went ahead and set up her supplies, which was an issue in her disinfection portion. The first thing she took out of the bag was a disinfectant that she wasn't familiar with. That's sad to me. They should be going through there, knowing what they're using, that sort of thing. So make sure that they're at least rifling through that kit in the beginning and looking at things and making sure they understand how things work and what things actually are, so they can perform these things. Also, their tripod. Make sure they know how to use their tripod. And that the tripod, we're getting some really flimsy tripods in the examination. Some of those don't perform very well. Let's make sure your candidates know and understand how to use those, and that maybe the quality is a little bit better, or they're not at least going to break during the process of examinations. Candidates must not leave the examination area without permission. If they experience an emergency, need to use the restroom, that sort of thing, raise your hand. The examiner will come over and they will be able to sign out and go do those things one at a time. No additional time is given to a candidate under those circumstances. Examiners have been instructed not to answer any questions, as I said. This ensures equal opportunity for all candidates and ensures standardization and testing for practical examinations. So your examination that you take in California is performed the same way we take it in Utah, or they take it in South Carolina or Washington or anywhere else. So we try to really stick to the standardization. Therefore, our examiners or proctors may make only the following statements when addressing the candidate questions or situations. All they're going to be told is do the best you can with what you have available, or do as you were taught. Those are the only two statements that will be made to those candidates when they raise their hands and ask, my shears fell apart. They're going to be told to do the best they can with what they have available. So those types of situations, yeah, they are an emergency for those candidates, but in the examination, they need to know how to react. This is a practical examination. How do I react if my shears break? What do I do? Cut it with my razor if I have to, I guess. Try to put the shears back together. So those are types of decisions that those candidates have to make on the fly when things happen. But you can email questions to nictrainers@gmail.com. We would appreciate only receiving questions from schools or instructors. We've been getting quite a few questions from students, and we obviously will refer them back to the school. We would like the school to have the answer, so make sure that the instructors and schools are directing the questions to this. You can also send questions right now to nancy.harlow@dca.ca.gov. We are going to take just a little 5-minute break. We will be presenting cosmetology next. That will be our next area that we'll be talking about. So we'll be back in 5 minutes. Okay, we're back. I don't think we really had any questions in that section. We're going to go ahead and go straight into the new cosmetology content. Like I said, it's different. We will be kind of taking our time walking through this. Please email any questions that you have to nancy.harlow@dca.ca.gov. Please wait until the section's been presented. I think you'll find that we answer a lot of the questions in the sections. But if you do have a question, absolutely email it to us. We'll make sure that we get you an answer. But we have standardized the work area and client preparation and setup of supplies sections. They're 15 minutes. You'll prepare your work area for your client. You will set up the universal supplies you'll use throughout the examination. You'll also set up supplies for the following sections of the examination: thermal curling and hair cutting. Plug in your curling iron at this time. You'll prepare your client for services. You'll be expected to follow client protection, safety, and infection control procedures. You will have 15 minutes to complete this section. You'll be informed when you have 8 minutes remaining. Step back to indicate you've finished. The instructions will be repeated. So basically what we've told them or asked them to do is to prepare the work area for their client. We've told them to set up thermal curling supplies and hair cutting supplies along with their universal supplies. Plug in their curling iron. Make sure their curling iron's working properly. And also prepare the client, which means draping. All those things are done with infection control and safety procedures in mind. And we're going to move forward to the first section after that. They're asked to begin. They do need to disinfect their work areas completely with a product labeled in English as an EPA-registered hospital-grade disinfectant. And as we said in the last presentation, they do need to have a manufacturer label on the bottle. It does need to be legible. This is not a label you cut and pasted. This is not a label you created. This is the label that the manufacturer has on their website or already has on the bottle. Make sure that those are clearly read. One of the big things we see here across the board is someone will bring in a tube of hospital-grade wipes, and they have a manufacturer label on them already, and then they'll stick a disinfectant label over the top of it that says disinfectant, and then you can't read the label. Make sure they're only, this container of disinfectant should only have a manufacturer's label from the manufacturer of the disinfectant. So again, this label has to be a manufacturer label, not a created label. It also needs to be a hospital-grade disinfectant, so it needs to be a medium-level disinfectant. Go ahead and, if I buy it at a beauty supply, it's more than likely going to be that grade. If I buy it in a supermarket, it's not. So make sure that you're using professional products in the examination. Sanitize his hands with product labeled in English. So again, my hand sanitizer needs to have a manufacturer label in English. Universal supplies are labeled in English. I need to make sure that all my universal supplies are labeled. My bags need to be labeled the way the CIB asked me to label them. My disposal containers, they need to be labeled, one with trash, one with to be disinfected, and one with soiled linens. I need to have 3 separate containers with liners in those particular bags or containers. I'm going to set up my universal supplies, which are the disinfectant, the hand sanitizer, any paper towels I might use, maybe my spray bottle of water. Anything that I'm going to use throughout the examination becomes my universal supplies. But I'm also going to set up for the thermal curling and the hair cutting, which are specific supplies. Our examiners have expressed to us in trainings that the candidates are leaving supplies in bags on the station. They should be using bags, and I showed it in the last presentation. I should have a first client bag where I have my supplies in there for thermal curling and hair cutting specifically. I set up all those supplies for both those sections and throw that bag in the trash. That's the best way to do it. They cannot leave things in the bag on the station. The supplies that need to be used need to come out of the bag and on top of the station. They can keep supplies in their kit, extra supplies, but make sure they're only bringing enough extra supplies that are feasible. They're not bringing, huge containers of supplies that they'll never use. But they will now perform thermal curling. You will form 2 curls on the top of the head and 2 curls on one side of the head. You'll complete a complete curl must be formed from base to ends. So we never have required a barrel curl. We require a curl that starts at the base of the hair and goes through the ends of the hair. You'll be expected to follow client protection, safety, and infection control procedures. You'll have 10 minutes to complete this section. You'll be informed when you have 5 minutes remaining. Step back to indicate that you finished. Instructions will be repeated. We're going to go ahead and repeat those, and then the candidates will be asked to begin. We're going to make sure all thermal curling supplies are labeled in English. So anything that they're using in their thermal curl section, maybe a thermal spray if they bring it, or a gel if they bring it, or any supplies that they may have forgot to set up and they pull out of their kit that they're going to use for the thermal curling, that's where we're going to grade those labels as they see them, strictly for the thermal curling section. Implements and supplies are visibly clean, so that curling iron may have a stain from the heat, but it doesn't have crusty stuff that I can scrape off with my fingernail, and then it's dirty. But all those implements and supplies, combs, brushes, whatever they're using, need to be free of hair, clean, ready to go for a new client. They test the temperature of the iron. This only needs to be done one time. And we've been here several years now. We've continued to say it only needs to be done one time. Just before it goes into the hair, they need to test the temperature to make sure it's not going to damage the hair with excessive heat. Once they start working in the hair, it's going to cool the iron down. So before they apply the iron to the hair, they do need to test the temperature. It needs to be an electric Marcel or an electric spring iron. It needs to have a clip, in essence, so they can run a material through the clip in the barrel to test the temperature or the heat of that iron at that time. Throw that material away. What do I use for that specific test? I could use a neck strip if that's what I want to use. I could also have a roll of paper towels on my station. I could simply tear off a paper towel, fold it, and run it through the barrel. And that would also satisfy that requirement. But the main thing is that once I'm through with that material, I throw it in the trash. I don't need to test it again. I'm done with the testing. I then start subsectioning the hair for thermal curling. What does that mean? My subsections are the length of, appropriate for the barrel of the iron. They're that sort of thing, that the hair is going to fit on the iron in those subsections properly. Demonstrate safe use of iron. That means I'm not tapping the iron with my hand, my bare hand, to see if it's warm enough yet, or if the curl or the hair is getting too hot. Those are unsafe procedures. I need to make sure that my hand is remaining free of the barrel. I can, of course, hold the end if I need to, but I can't wear a glove that's heat resistant. I have to be able to perform these tasks with my bare hands and a curling iron. But safe use would be maintaining the cord so it doesn't wrap around someone's neck, that sort of thing. We are going to look at the final appearance of the 4 curls while they're being curled. Make sure they're rolled from base to end. Make sure they rolled 4 curls. Make sure the positioning of the curls, because we ask you to do 2 on top of the head and 2 on one side of the head. That's where we expect those curls to end up. One side of the head or the other should have 2 curls, and the top should have 2 curls. So we do evaluate that they're being curled from base to end and that sort of thing in that 2.6. They need to maintain the drape throughout the section. In this examination, as I said last time, the draping does matter. So they can't be using a drape that would melt. They need to use some type of a thermal drape during the thermal curling. They can also continue to use that same drape through the haircut, but this cannot be a drape that's going to melt with the contact of the iron. They also have to have a neck strip or a towel, preferably a towel on these mannequin heads. They seem to stay on a little bit better. We're still seeing some things aiding the holding of those towels. Make sure you're not putting anything on the neck of the mannequin except a towel or a neck strip. They can't have anything that's going to help a grip, anything like that. But the drape also needs to stay up on the neck of the mannequin. It can't fall down onto the tripod. If it falls down on your tripod, stop. Set everything down, fix the draping, and then move on with your thermal curling after you sanitize. But make sure that you're fixing that drape if it happens. If the drape falls on the floor, I need to replace it with a clean drape. So I would need to dispose of that drape that hit the floor into the soil linen bag. I would then need to pull out a clean drape and towel and reapply that draping or cape as necessary. Items to be disinfected, soil linens and trash are all disposed of in the correct manner throughout the section. So as I throw things away, I'm putting them into the bags that they belong in or the containers that they belong in. What do I do with my curling iron? Unplug it, leave it there, set it off to the side. Let it cool is the main thing. We don't want to wrap it in a towel and throw it into items to be disinfected while it's hot. We don't want to put it in an oven mitt. No oven mitts in the exam, please. Just simply unplug the curling iron when you're finished. Make sure that the cord is out of the way. Nobody's going to trip over it. And just push it off to the side. We then are going to begin the hair cutting section. It's a 30-minute section. As I said before, the State Board haircut is gone. We're now doing what you taught him to do. You'll perform a haircut. You'll complete a basic layered haircut using razor and shears. You will cut at least 1 inch of hair throughout the haircut. Do not remove your hair clippings from your work area until you're instructed individually by the examiner to do so. You'll be expected to follow client protection, safety, and infection control procedures. You will have 30 minutes to complete this section. You'll be informed when you have 15 minutes remaining. Step back to indicate you've finished. The instructions will be repeated. We're going to go ahead and repeat those instructions, but what we ask them to do is to perform a haircut. It needs to be a basic layered haircut. They need to use razor and shears. So we're establishing a haircut using razor and shears. That's very important. If your candidate comes in and just chops a few hairs off with a razor, thinking that's going to satisfy the requirement, that is very deceiving. They do need to use that razor, say, to do a perimeter or go in and thin the hair or texture the hair. They're going to need to use and demonstrate competency with that razor, and so they need to use it enough amount of time that the examiner sees that that is being established in part of the haircut. They do need to cut at least 1 inch of hair throughout the haircut. They need to step back once they're finished and wait to be told to sweep and clean and do those types of things. Their hair cutting supplies are labeled in English. What hair cutting supplies do they bring? I can't really tell you, but if I forgot my water bottle at this point and I pulled it out, that would become a hair cutting supply. So we will look at the labeling of any supplies that they're using throughout the haircut. If it needs to be labeled, so be it. Make sure it's labeled. I do ask, or I do recommend, not ask, but recommend that you put a Ziploc bag full of gloves on the table. The reason I say to put those up on the work area is during the haircut, if I have a blood exposure, I cut myself, I need to do a blood exposure procedure, I have gloves already located on the station and the chemicals. If I break a glove, I've got a glove already on the station. So they can go in and have that little bag of gloves, sanitize, go in, get your gloves out, zip it shut, move on with your section. If I cut myself, I can sanitize, take my uncut hand, put it inside that bag, pull a glove out, isolate the cut, and then I'm able to work a little easier. So that bag of gloves really does come in handy. It doesn't need to be labeled gloves. We know they're gloves, it's a supply. Only products need to be labeled. Everything on that table is visibly clean. My combs, my brushes, things don't have hair in them. I'm going to subsection that hair for hair cutting. So as I subsection, I'm using consistent subsections and guides. Demonstrate safe use of a razor. I'm pointing it away from the head, controlling my razor in a professional manner so that I'm not cutting anyone. If I do cut myself, I do need to do a blood exposure procedure. Don't hide it. If you decide that you aren't going to do a blood exposure procedure and the examiner notices it, you will be pulled aside to do it anyway. So you might as well just do what you're taught and go ahead. If I cut myself, it happens. We all do it. And I'm just going to go ahead and do that blood exposure procedure. Demonstrate safe use of shears. Am I pointing the shears away from the head? Am I keeping the tips closed? That sort of thing. Basically, it's the same haircut. We just don't require you to cut the nape with a razor. We require you to use both tools in the haircut. By demonstrating that safe use of shears, again, if I cut myself, I'm going to take care of it because that's the practical examination. It's not what happens, it's how I deal with the situations that happen when they happen. But once those haircuts are completed and everyone step back, or the timer goes off, and once the timer goes off, please make sure they just step back. Set everything down and step back. The examiners are going to go to the candidates and start checking them one-on-one. They will approach one of the candidates and say, "May I please use your comb to check your haircut?" They're going to, the criteria for the haircut, they're going to cut the entire nape line to a uniform length, cut the sides to a uniform length, and their haircut's blended. And that's what those examiners are going to be checking for. The examiner will then please ask them, "Please clean up your hair at this time. Upon completion, do nothing until the next verbal instructions are given." At that point, the candidate, there are brooms and dustpans provided in the examination sites. They will need to remove the hair from their work area, meaning they sweep the floor, they clean off the cape, they clean off their work area, in essence, clean up all the hair. They do need to leave the cape on the mannequin. They can take it off and shake it and put it back on, that's fine, but they do need to maintain the cape until they're asked to remove it. Items to be disinfected, soil, linens, and trash are all disposed of in a correct manner throughout the section. Once that examiner has gone around the room and examined all the candidates, they will say, "We are ready to proceed." When cutting the hair, I would say that in this first illustration, that's pretty borderline on a 1-inch haircut throughout the head. They are 1-inch pieces, but there's just not a whole lot of hair on the floor. These are longer than 1-inch pieces. That's not required. We just expect you to take at least 1 inch off, but there is a substantial amount of hair on the floor. These examiners are cosmetologists. They understand what a haircut is, and they understand how much hair needs to be on the floor to establish a 1-inch haircut. So let's make sure that they're actually coming in and cutting hair and showing competency with razors and shears. But they are going to perform that haircut that you taught them. At the end of the haircut, we're now going to go ahead and set up for our second client. So you will break down your work area and dispose of supplies used in the previous sections of this examination. That's all your draping. Anything you're not going to use anymore, let's get it off the station. We need to change the draping. We can use the same mannequin head. You can actually use the same mannequin head through the whole examination as long as you don't cut the hair too short. You'll prepare your work area for a new client. So I'm going to disinfect and prepare for a new client. I'm going to set up the universal supplies I'll use for the remainder of the examination. I'm also going to set up all my chemical sections. So I'm going to set up chemical waving, predisposition and strand test, highlighting with foils virgin application, hair color retouch for 1 inch of regrowth, and the virgin relaxer application. We're not using the hard wax portion in this exam, so that will be taken out. You will prepare your client for chemical services. This means I need to apply a chemical cape for the chemical services. The chemical cape required in this examination does require 2 towels. You can't do a single towel chemical drape. They need to use 2 towels. They'll be expected to follow client protection, safety, and infection control. They'll have 15 minutes. Be informed when you have 8. Step back to indicate you finished, and we're going to repeat those instructions. So, As I said, they, they need to disinfect their work areas completely with a product labeled in English as an EPA-registered hospital-grade disinfectant. So if I brought a bad disinfectant, I've now missed 2 tasks because I don't have the right disinfectant or that my label's not correct. Not to mention, if I ever had to use it in any other situation, I would have a problem as well. So if I was to drop a necessary implement, my curling iron or my shears were to drop on the floor, I only brought 1. I can wipe those down with some disinfectant, sanitize my hands, and return to work. However, anything other than that, combs, brushes, those types of things would need to be put into items disinfected and replaced with a clean one. I do need to sanitize my hands, set up my universal supplies that I'm going to use in these sections, which may be protective cream, but I still need to leave my disinfectant and my hand sanitizer on the table, just like I do every day. It has to stay out all the time in case I need it. So those disinfectants and sanitizers do need to stay out on the table all the time. We do not allow you to bring pre-draped mannequin heads or pre-sectioned mannequin heads. You're going to bring that mannequin head in and section it in the exam and drape it in the exam. Be sure that that's being done. So once I'm finished, I'm going to be throwing things in the right containers with the intention of what I'm going to do with them. I'm going to enter my chemical waving section. This section really hasn't changed very much. It looks different, but it's still chemical waving. Just like haircut, it's still chemical waving. You'll perform a chemical waving. You'll wrap the center back section of the head from crown to nape. Once you finish wrapping, please step back and wait for the next verbal instructions to be given. Do not perform the saturation procedure, a test curl, or remove a rod until instructed individually by that examiner to do so. Do not remove the remaining rods until you're instructed to do so. You'll be expected to follow client protection, safety, and infection control. You'll have 20 minutes. Be told when you have 10 minutes. Step back to indicate you've finished, and we're going to repeat those instructions. The candidates will be evaluated on the chemical waving supplies labeled in English, so that saturation fluid needs to be labeled. Please send them with a proper saturation bottle. Toner bottles seem to really make it run all over. Keep some old saturation bottles, label them, put a cap over them, whatever you have to do to hold it in there, but make sure they have a good bottle for saturation. Their implements and supplies are visibly clean, so those rods don't have hair in them. The papers haven't been used or aren't dirty. They're going to subsection that hair for chemical waving. What does that mean? The subsections fit on the rod properly. It's all about subsectioning the hair. The wrapping the hair is all about putting it on the rod, and the rod placement is all about the way they wrap the rod. So in wraps hair, they do need to use a paper. They can use any type of wrapping technique, bookend, double wrap, however they want to do it, however you teach them is fine, but they do need to use a paper. They do need to extend the paper beyond the hair ends. Pretty much the same criteria you're teaching now is the same criteria for chemical waving. Nothing's really changed in chemical waving. The correct rod base placement, again, used throughout the entire section. So if I start on base, I end on base. If I start off base, I end on off base. If I decide to do an on-off base, I continue with that pattern throughout the wrap. So we're going to be looking at the rod base placement. Once they finish with that or the timing has elapsed, we want to see a nice wrap that creates kind of a C shape around the back of the head. You are only wrapping from the crown to the nape. They do need to complete the wrap or they will lose a certain amount of that, the point. So, as I said, there's no particular sectioning that we use, no particular wrapping that we use. Just simply get the hair, section it off out of the way, and wrap that center back section from the crown to the nape. You'll also see in the bottom illustration, you see tape around the mannequin. That's a little confusing to some of you, but what really happened there is there was a name on that mannequin head. We don't care to see the candidates' names, and so this candidate had put a piece of tape around the bottom of the mannequin to cover up the name. It's not affecting holding the towel on. I had that question the other day. It's above the towel. You cannot put anything around the neck to hold the towel on. But you also see that piece of cotton at the nape, and we're going to talk about that in just a second, but I wanted to point that out in the bottom picture, that that cotton is at the bottom. After the wrap's been completed, all the candidates have stepped back or timing has elapsed, the examiner will approach a candidate one-on-one, and they will say, please demonstrate saturation. That candidate needs to show competency in demonstrating the saturation. Therefore, they would need to apply protective cream or cotton, at least at the bottom of the bottom rod. They can wrap the section with cotton, that's fine. They can put protective cream around the head, that's fine. But they do need to apply either cotton or protective cream. They also need to apply their gloves. Anytime we're working with chemicals, of course, we need our gloves on. And then they need to saturate each rod. We are seeing a lot of the rods being saturated with pieces of cotton stuck between them. Please don't do this. That puts undue stress on the hair. They're going to have issues with that. They should be saturating, holding a towel maybe underneath, or just not saturating to the rods to the point that they're dripping off onto the floor. If they do drip off of the floor, they do need to clean that water up immediately. In order to maintain their area in a safe manner, they do need to clean that water up. So make sure they're doing that as well. We're seeing a lot of candidates putting towels on the floor before they saturate. That's an unsafe work environment. Don't put towels on the floor that you're going to trip over and get your feet wrapped up in. Make sure that they're demonstrating saturation in a proper manner the way you're teaching them. If there's any questions on saturation, you can refer to your textbooks and they will give you proper procedures for those. Please demonstrate a test curl. They will then demonstrate a test curl, unwrapping the hair 1.5 turns. Hair is held to relax, wrapping the hair back to the head. That's a definite test curl. If the rod does fall out, of course they do need to replace that rod. So make sure that if the rod does pull, they're able to get a clean paper, rewrap the rod, and wrap it back to the head. They've recovered from that coming out. The examiner will then ask them to please remove one rod from the head. The main question here is which rod? Just one rod? Any rod. So just take a rod out of the head, and the examiner will step back, ask you not to remove the remaining rods until instructed by them to do so. Once the examiner has gone around the room and checked all the candidates, I know you're saying the cliffhanger, what do I do with that rod? You need to dispose of that rod properly. Paper needs to go in the trash. The rod needs to go in items to be disinfected. As the examiner moves around the room, do not remove the rods from the head. Step back, breathe, wait until they're told to remove the rods. Once the examiner has completed the room examining, they will instruct the candidates that they've been ready to proceed. Please remove all the remaining rods from the head and create 5 sections for the remaining chemical services. You'll be expected to follow client protection, safety, infection control. You'll have 5 minutes to complete this section. You'll be informed when you have 2 minutes remaining. Step back to indicate you've finished. So at that point, the candidates are going to go ahead. They're going to take the rest of those rods down, dispose of them properly, and they're going to create a 5 section. And the 5 section they're going to create is a mohawk from the crown to the, or from the front hairline to the apex that they can put their foils in. And then they're going to put 4 quadrants around the sides of the head, just like they do now. But they are going to create that 5th section up in the top, just wide enough to put foils in from crown to apex. This is a picture of maybe what that 5 section would look like. Again, if you have questions, nancy.harlow@dca.ca.gov. But we do evaluate the candidates at all times. So even after the examiner has walked away, or they're still being evaluated. And that's why I say wait till they tell you to clean up, wait till they tell you to put something away, because there's certain advantages to doing that in this examination. So, you know, make sure they're maintaining the drape. They don't take the drape off until they're, you know, there's a logistical meaning to taking the drape off and putting it away. This is the same client through all the chemical services. They're going to use that same drape. Unless that drape falls on the floor, then it needs to be replaced with a clean one. But items to be disinfected, soil linens, and trash are disposed of in a correct manner throughout the section. So as they're disposing of their rods, we are evaluating that. We're evaluating where they're putting everything. If they did hold a towel underneath, that would definitely need to go into soil linens. Once it's got chemical on it, it can't go back on the stations. We're going to move into the predisposition and strand test. You will perform the predisposition test and strand test for permanent hair color. You will demonstrate the predisposition test behind the ear. You will demonstrate the strand test process on any one subsection of hair. You will be expected to follow client protection, safety, infection control procedures. You'll have 10 minutes to complete this section. You'll be informed when you have 5 minutes remaining. Step back to indicate you've finished. The instructions will be repeated. This is all done together in a 10-minute section. Predisposition and strand test supplies are labeled in English. Implements and supplies are visibly clean. So everything on my station at this point is clean. I haven't set any dirty rods down and not cleaned them up and that sort of thing. Demonstrates predisposition tests behind the ear. They would need to cleanse, pull out their color bowl, because as I told you in the last time I was here, I said it's probably better if you create 3 bowls, one marked color with enough color to do the predisposition and strand test and the back section of the head, one marked lightener, enough to do 4 foils, and one marked relaxer, enough to do 1 single subsection. So I would create those 3 bowls, because in this predisposition test, all they need to do is reach out, take the bowl that says color on it, open it up, cleanse the skin, swab the skin with the color, throw that swabbing mechanism away, do the strand test out of that same color bowl. However they do it, with a piece of foil and a brush, they will go ahead and brush that strand with some color. They're then not going to wait for it to process. It's just color on, color off. So once they get it on there, they just spray a little water on it with their spray bottle and wipe it clean with the towel, dry the hair. They're going to be good to go. They put the lid back on that color, put their brush and items to be disinfected, and they're through with that 10-minute section. But they do need to maintain their drape throughout the section and be sure they throw things in the right containers. Highlighting with foil, virgin application with colored simulated product is their next section. That's a 15-minute section. You will perform highlighting with foil virgin application. You'll place 4 foils on top of the head from front hairline to the apex. You'll apply simulated product from the upper edge of the foils to the hair ends. You'll be expected to follow client protection, safety, infection control. You'll have 15 minutes. Be told when you have 8. Step back to indicate you finished. We're going to repeat that, and we're going to go ahead. So this says I have to start at the front hairline with the first foil. I can weave, I can slice, I can chunk, I can just do a foil. So make sure they're starting at that front hairline. If it were me, I would tighten that foil up enough that it's not dropping down in the eyes or flopping around. They can leave spaces between the foils. So they would place their first foil on the front of the front hairline, and then they would work their way back with 4 foils to the apex. They only put in 4 foils, following instructions. But they're going to subsection the hair for highlighting with foils. They're going to make sure that those subsections fit in the foils, that sort of thing. Use correct foil placement so the foils are tight, they're wrapped, they're not oozing any product out, and so forth. And then once they're through with those 4 foils, they are going to step back and wait for further instructions. Or if the timer goes off, they're going to step back and wait. The examiner is going to step forward and remove 1 foil from each mannequin head and inspect the results of that foil, making sure that there's saturation, making sure that there's, the hair is contained in the foil, that it's saturated from base or from the scalp to the ends, and so forth. That foil that's not oozing out of the foils and so forth. But then they're going to tell that candidate, please do nothing until the next verbal instructions are given. They'll move to the next candidate until they've completed the room. But again, even though the candidate has been evaluated on their foil and the examiner is moving about the room, they're still being evaluated, and they need to continue to maintain infection control and safety procedures. If I drop a color brush on the floor, or a lightener brush on the floor, I have 2 issues. I have product on the floor, I have a brush on the floor. I need to pick up the brush, put it in items to be disinfected. I need to clean up the product off the floor, throw that in the trash. I need to sanitize my hands, get a clean brush, and go back to work. I'm good to go. Once the examiners have gone around the room and checked everybody, the examiners will then tell the candidates that they're ready to proceed. They will go on to the hair color retouch section. We do recommend that you color the simulated product so that we can see it go on the hair. You'll perform the hair color retouch application. You'll apply simulated color product to one section of the back of the head. Your client has 1 inch of regrowth. You'll be expected to follow client protection, safety, and infection control procedures. You'll have 10 minutes to complete this section. You'll be informed when you have 5 minutes remaining. Step back to indicate you've finished. The instructions will be repeated. You may begin. So, what we asked them to do was apply one of the back sections. Or apply to one of the back sections. So one of the back sections, the right or the left rear section, they'll be applying the entire section in this case. All their hair color retouch supplies are labeled in English. Well, this is simple now. I just reach up, grab that color bowl again, my lightener bowl's put away, and I can apply it to that same color bowl that I did my predisposition and strand test out of. And on top, or on that color bowl, it's only labeled with color, not what I'm doing with it, just color. But all those implements and supplies are visibly clean, so when the examiner walks past their table after the setup, those old color brushes are discarded. They have new color brushes out. Everything's clean on the table. They're going to subsection the hair for a color retouch. That's all about their subsectioning. They're going to apply the simulated product. So that's all about the application. It's a 1 inch retouch. So they're only going to be going from the scalp out 1 inch on these retouches. Making sure they don't get it on the skin. If they do get it on the skin, they get it off. All those different things. They need to outline at some point. So those, the color retouch didn't change. It just looks a little differently on the CIB because of this displays competency. By not telling them step by step how to do it, they should already know how to do it. They're going to be made a professional if they pass this examination. We're going to watch the final result of the hair color application, make sure that the saturation and the application are correct. They need to maintain the drape throughout the section. Items to be disinfected, soil, linens, and trash are disposed of in a correct manner. We then move on to the Virgin Relaxer application with simulated product. Again, it's a good idea to color that product. You'll perform the Virgin Relaxer application. You'll apply simulated relaxer product on a single subsection of hair. You'll be expected to follow client protection, safety, and infection control procedures. You will be instructed individually by the examiner to demonstrate the Virgin Relaxer application procedure. This is an untimed section. Do not begin to demonstrate the Virgin Relaxer application until instructed individually by the examiner to do so. Those instructions will be repeated. The examiner will walk over to one of the candidates. They will make sure the Virgin Relaxer supplies are labeled in English. So that bowl of relaxer, it says relaxer on it. Implements and supplies are visibly clean. All the color brushes are clean. I've thrown away the one, or actually disposed of in items to be disinfected, the ones that I previously used. Please demonstrate the Virgin Relaxer application procedure. Well, the procedure would be to apply my gloves, to apply the protective cream around the scalp. This is a non-base relaxer. They're going to go ahead and section off a small subsection. They're going to apply to mid. They're going to apply up towards the scalp, and then they're going to apply the ends. So however you teach them to apply that non-base relaxer, that's the way they're going to do it. But once they've completed that, they're going to smooth. Smoothing is in the direction of hair growth and cuticle. They need to smooth the entire subsection. What we see right now is they're only smoothing to their fingers. If you did that in an actual relaxer application, you would have some problems with the ends, I would imagine. So those do need to go through the ends. The examiner will then ask the candidate, please do nothing until the next verbal instructions are given. They are required to maintain their draping. Items to be disinfected, soil, linens, and trash are disposed of in a correct manner throughout the section. The examiner is going to go around to all the candidates in the room and go ahead and assess them individually. They will then say they are ready to proceed. We will move on to the blood exposure procedure, which is a 10-minute section. You will demonstrate the blood exposure procedure. You will imagine the following scenario. During a service, you have sustained a minor cut to your index finger. The injury is such that you can continue with the service. Your work area or your client has not been contaminated. You're expected to demonstrate the proper procedure for a blood exposure. You're expected to follow client protection, safety, infection control. You'll have 10 minutes, be told when you have 5. Step back to indicate you're finished. So in other words, the whole group is going to do the blood exposure procedure together in a 10-minute section. Previously, in examinations, up to this date, they've all been individually examined on their blood exposure. I will say across the board in blood exposures, as of the administrations on the 19th, they will all be 10-minute segments rather than individual segments. But the blood exposure supplies are labeled in English, removes materials from the first aid kit. Supplies and materials are visibly clean. Cleans injured area with antiseptic. Covers with dressing that's absorbent and secured. Candidate wears glove or finger guard. Disposes of all contaminated materials. So let's go back. We want to make sure that all those supplies that they're using are labeled in English. My first aid kit is labeled. Needs to say first aid kit on it. I'm going to remove the supplies from the first aid kit. Now remember, I said it's a good idea to put some gloves on the table. Whenever they need gloves, they can just sanitize, reach in there and grab some gloves out. Well, if I've cut my finger, I'm either going to have to try to sanitize my hands and go in with one hand, or I could sanitize my hand, get a glove out, put it over the cut finger, and now I can sanitize the glove and I can go into my first aid kit, remove the supplies, makes it a lot easier. The first thing I'm going to pull out is a bag, closable bag, plastic bag. As I take off the glove, I'm going to put that in that plastic bag. I'm going to get my antiseptic. Any paper that's on that antiseptic, I'm going to go ahead and wipe that off. I'm going to put that paper in the bag. I'm going to put that antiseptic wipe in the bag. Whatever I used is going in that bag. Then I'm going to apply a bandage. I'm going to take all the paper off that bandage and put it in the bag. I then need to wear a clean glove or a finger guard over that index finger that I cut. So I do need to apply another glove on my hand. I have my gloves on my station. I can simply sanitize my hand, get a clean glove out, put it on my hand, and I'm ready to go. Or maybe I have a finger cot. I can just put a finger cot over it. But you do need to cover that. When we say dispose of all contaminated supplies, that means that I close that bag that I just put all those contaminated supplies in, and I deposit them in the trash. Once all candidates have completed that section, we will go into the different additional sections. You will be either doing a facial or a sculptured nail. You do need to come supplied to do either one. So make sure you have the supplies for the basic facial in your kit, and make sure you have the supplies for the sculptured nail in your kit. As we go through these examinations, your sculptured nail comes straight out of the aesthetics exam, the nail exam, and the facial would come out of the first client of the aesthetics exam. So we don't cover those in the overview. We're going to cover them as we go through those sections. But you will have 2 minutes to set up the supplies for the basic facial section of this examination. Please do nothing until the exam, so forth. So step back to indicate you've finished in the case of the aesthetic sections, or turn the hand in the case of the nail sections. Those instructions will be repeated. So you won't have an additional disinfection, all that stuff. After the blood exposure procedure, you'll simply get out the supplies to do the next section that you're asked to do. And go ahead and perform that section. It's not a new client. It's the same client. Very simple. So basically, that would be the end of the examination at that point. Again, you can email us at nictrainers@gmail.com. We do, however, recommend that is the instructors that are emailing us. Instructors and school owners only. If you are a student, we will refer you back to your school and have the school ask the question, because we do know that if you have the question, there's probably other people in the school that have the questions. So we'd like everybody to hear the answer. So please have your instructor email us, and we'll go ahead and take care of that at that time. So we'll be back in 5 minutes to answer questions that you have on the cosmetology exam. Thank you. Thank you for your patience. We do have a couple questions that we'll answer. It says, do candidates need to apply the protective cream and cotton to the client for chemical waving service? It's not listed on the CIB task lines. It should be listed on the CIB task lines, is it? Oh, when they demonstrate saturation, yes, they do need to wrap it. It's the saturation process. So they would need to apply protective cream or cotton. They need to apply their gloves, and they need to go ahead and saturate. So no longer do we list out separately the steps of a procedure. They should be competent. They're going to be professionals. Once they leave this examination and pass, they need to know how to demonstrate competency. That would be putting on the protective cream or cotton, putting on their gloves, and saturating. So that would be the saturation process. Candidates wear gloves before they apply simulated waving lotion. There's no listed exactly. Anywhere they use chemicals, they're going to have to show competency enough to wear gloves. We don't list things out into separate little tasks anymore. They're doing what they're taught. They're doing what you show them to do. So if it's required to wear gloves during that chemical, absolutely, they need to wear gloves during that chemical. There was a couple sculptured nail questions that we answer in the nail exam. Can the candidate use the same cholesterol, same tint bowl, same tint brush for all chemical services? The examiners need to understand what they're applying. So as long as it's labeled as what they're using in that section, yes, they could do that. This says, do paper towels need to be in a closed container? No. If paper towels are out on the station in a roll, that's fine. We've never required paper towels to be in a closed container as far as NIC goes. The blow drying went away. Someone asked why there's only 4 curls, because that's all we need to evaluate. We've also dropped that down to a 10-minute section. I did get a question that it said, is there a logical reason that candidates are not required to demonstrate the disinfection procedure? Candidates are required in both setups to demonstrate the disinfection procedure. That is in setup number 1, section 1, and setup number 4. If they do contaminate their station, they are required to, again, demonstrate the disinfection procedure. The items that need to be labeled are products, any product. If you need the guidelines for that, it's in the OSHA guidelines, but supplies don't need to necessarily be labeled. NIC offers a standardized, valid, legally defensible examination program. And in California, you're the only testing facility that has shelves. I think the logistics of the shelves were causing a lot of issues as well. Candidates were putting things back up in the shelves. They were getting infection control issues. Those shelves became kind of a nightmare for your candidates by themselves. But again, it's a standardized exam. Everyone works out of a kit on the floor, and California has elected to work out of kits on the floor to standardize the exam here in California. So that's why they don't use the shelves anymore. We do have 2 separate clients in cosmetology. We have our first client that we do the haircut and the thermal curling on. We have our second client that we do the chemicals on. We have 2 clients in these examinations like we do in nails and aesthetics, because we want to see that a candidate is competent in preparing their workstation between the one client and the next client. So we see that one time. After that, there's 2-minute setups. I would imagine when the updated barber exam comes out, it will also have client changes in it as well. That is the new format. that we're using in our examinations. The candidate does need to come prepared to do the sculptured nail or the basic facial. They have to have both those supplies in their kit, ready to go, and know both of those sections. Those sections will change back and forth. I can't tell you what those schedules are. I don't know if those schedules will be published, but the candidates do need to come prepared to do both sections. The reason for the alternation is just randomness of the exam. We want this to be sure they're competent in both those sections and ready to perform them. At this time, they will only perform one. I can't tell you which one, but because I don't know. But they will perform one of the 2-minute setups. When doing the relaxer and color applications, are they applied to the mannequin in what direction? I'm assuming that means which sections do they apply it to. The relaxer application is on a random section, subsection anywhere on the head, so that it wouldn't relate to any quadrant. The color is in one back section, so either the right or the left back section. The strand test is random. We just give them enough clean sections that they can move around if they'd like to. If they prefer to do the predisposition and strand test in section 1 right here, and they also decide they want to do the relaxer application in 1 right here, they can do that. But the color application actually has to be done in one of the back quadrants, and the highlighting with foils has to start at the forehead and move in the mohawk. As far as the saturation procedure in the chemical waving, there's some confusion because in past examinations, we've allowed them to put on their gloves and cotton before the examiner gets over there. We do examine the full process now, so just have them stand there. When the examiner asks them to demonstrate saturation, they're going to go ahead and put on the protective cream or cotton. They're going to apply their gloves and they're going to saturate. It says if candidates are allowed to use the same color bowl for the predisposition and strand test and hair color retouch, what should they do with the color bowl while performing the highlight? They would just simply put the lid back on the color bowl or move the color bowl to the back of the station and pull out their lightener. That's fine to do. They're asking if every procedure has a cleanup time. We expect them to work with a client the way they would normally work with them. There is no specific cleanup time per section. All they do is perform the section, step back, perform the next section, then they're given the breakdown and setup of the next client. That's when they would clean up everything and set up for a new client. As they go through the chemicals, as they use things, put them in the containers as they go along. Once they take down that rod the examiner asks them to take down, they're going to be putting the rod in the items to be disinfected, the paper in the trash. They're going to step back and wait. They're going to be told to take down the rods and do a 5-section, then they're going to pull down the rest of the rods. So they're going to be told when to do things. When do they need to wet the towels for the facial section? Right before in that 2-minute setup would be the best time to do that. Let's say that the sink or they didn't get set up in time. They can walk up during the timing. Once the actual facial has started, they can walk up and wet those towels at that time if they wish. I'm getting some suggestions of how to apply chemicals to the head. The chemicals will be applied to the head the way that the subject matter experts recommended. We always call in subject matter experts to write these examinations and help us with the development, and they're the ones that come up with the processes. Obviously, there's some reasoning behind why they do things the way they do, so they do need to be applied the way they are stated in the examination. What type of simulated product would I use? Cholesterol is probably the best. It spreads on easy. It shows up a little bit. That's probably what I would use for those simulated chemicals. Do students need to use protective cream for the predisposition test and strand test? The foil section and the retouch section, you're going to apply those chemicals exactly the way you're supposed to. The books will tell you when to apply protective cream and when not to. That would be my best answer to that question. For the virgin relaxer, it's one individual section. So the virgin relaxer is performed in one individual subsection. So the examiner will approach that candidate, and please ask for the procedure. The candidate will then step forward. They need to do all the steps in that procedure on one simple subsection of hair. They're going to, at the point of smoothing at the end, they step back. The examiner will ask them to just wait until further instructions are given. They'll step back and go to the next candidate. So yes, it is a one-on-one examining of that procedure, and the examiner will go from candidate to candidate, one subsection of hair in the relaxer application. In the color application, they're doing one full back section of the head, and so those are kind of logistical differences in those applications. There's some definite conversation about how they applied all these chemicals. I do like them because there's a variation of how they're doing it, rather than just doing the same basic services pretty much over and over. We're evaluating different things in these chemicals. So the examination's working great. It's actually been in examination rooms since May of this year, and candidates are really feeling comfortable. We see a different type of candidate on this examination, one that's performing more of their skills the way they learned them. They're less nervous. I think that anxiety's gone down a little bit, especially in the haircut when they're trying to cut the back of the head with the razor for 20 minutes to get it straight. They don't have to do that type of thing anymore, but they do need to demonstrate competency with that razor. So make sure that they're just not coming in and chopping some hair with the razor and straightening it all out with the shears, that they're actually using that razor for a logistical purpose in that haircut, whether it's perimeter or texturing or whatever. They really need to show demonstration of use of that razor during that haircut. That concludes the questions. We'll be off air for 5 minutes. We'll come back. We're going to do the aesthetics portion next. Don will present that next. After the aesthetics portion, of course, we will do questions, have a 5-minute break, and then we will do, Don will present the nail portion. So we'll kind of proceed that direction. Any of the nail questions that we're asking, the cosmetology questions, Don will answer in the nail portions and the skin portions, wherever they fall into those examinations. So thanks for bearing with us today. We'll see you in 5 minutes.
Good afternoon. I'm Don Kerr, and I'm excited to be here and talk to you about the aesthetics program as well as the nail technician. Before I begin, let me tell you that to emphasize, just in case you tuned in, I would encourage you as a school owner or as an instructor to please make sure that you have the latest candidate information bulletin. It's so necessary. It works so well. And the information I'm going across today will be the same verbiage that we will be using in our exam. Therefore, you have that verbiage. You can practice with those candidates prior to arriving, and they'll feel much more comfortable in taking that national exam. So let's begin talking about our aesthetics exam. Our estheticians are in place. They'll be told, you will prepare and set up your work area for your client. You will also set up the universal supplies that you will use throughout the examination. You will also set up for cleansing the face with product, exfoliating the face with product, using implement or materials, and including towel steaming, massaging the face with product. Prepare your client for the services. You will be expected to follow all client protection, safety, and infection control procedures. You will have 15 minutes to complete this section. You will be informed when you have 8 minutes remaining. Step back to indicate you've finished. At this point, our instructions are repeated, as they always are, and then our candidates are told, you may begin. We are looking to see that they disinfect all work areas completely with product that's labeled in English, and Sean spent time earlier today talking about that disinfectant. The minimum thing that they can do is to disinfect that work area with a hospital-grade, EPA-registered disinfectant. We see our estheticians sometimes go ahead and put a cloth towel over the top of that for their work area, and that's fine as well, but the minimum they have to do is to disinfect that area. Then we want to see that candidate sanitize their hand with product that's labeled in English, and it too must have a manufacturer's label. Our examiners will be looking to see that the universal supplies are labeled in English. If the original manufacturer's label is present, it must have English and may be multi-language, but any other created label must be only English. We will be looking to see that they apply protective covering to the model or mannequin, both the hair and the body. So they'll be draping the head. That could be with a towel if that's the way that you teach. It could be with a turban. It could be with a headband. We will examine what you are teaching in your schools. Afterwards, because they've touched the hair, they certainly will need to sanitize their hands and place a protective covering over the décolletage area. We're always looking to see that items to be disinfected, soiled linens, and trash are disposed of in the correct manner during that section. Let me address that. We do like the gift bags that have the plastic liners in them. We ask you to please label those and turn those labels so that our examiners can see them. It just makes their job a lot easier, and we certainly want to make sure that your candidate gets credit for putting the appropriate item in the appropriate container. Now, if everybody has stepped back to indicate that they have finished, our proctor will say all candidates have indicated that they've completed this section of the examination. We will now proceed to the next section. But if people are still working, when that timer does go off, our proctor will say, please stop working. This is a typical setup for an aesthetics exam. You can see that this candidate opted to put a to-be disinfected container on the table. It does take up a lot of space there. That's why I encouraged it to be on the floor in a gift bag with a liner. But however, if it is going to be on the surface of the workstation, it has to be closed at all times, except when a candidate is putting used materials or items to be disinfected into that receptacle. Our next section is cleansing the face with product. Candidates are told you will perform cleansing the face with product. You will be expected to follow all client protection, safety, and infection control procedures. Let's talk about that for just a minute. When we talk about infection control procedures, these are the things that you're teaching in your school or that are happening in the salon. I know that if I sneeze into my hands or touch my hair, that I have to sanitize those hands prior to touching my client or my mannequin. If I sneeze on that work area, then I have to disinfect that work area again. I know that I can't remove products from jars with my fingertips or even with a gloved hand. I know that I shouldn't be double dipping, and I know that I can't touch tips of containers. Were I to touch a trash can, I certainly would have to sanitize my hands before going ahead with my services. So these are all the kinds of things that we're talking about when we say follow client protection, safety, and infection control procedures. Now, they will have 10 minutes to complete this section, and they are informed when they have 5 minutes remaining. They're told, please step back to indicate you have finished. The instructions are repeated, and they're told you may begin. Our examiners are looking to see that the facial cleansing supplies are labeled in English, that the implements and supplies are visibly clean. We want that candidate to cleanse the eye area completely and cleanse the lips completely. And here again, that's the way that you've taught them to do. At one time, our textbook said to cleanse the lips, you needed to take a tissue and fold that into quarters and put some cream on there and go from corner to center and corner to center. Now we're just telling you or telling that candidate, cleanse the lips completely. And they're to do that the manner in which you as an instructor have taught them to do. We do want them to distribute the cleanser over the entire face and then afterwards remove any residual makeup and cleanser. After removing that cleanser, we want that candidate to apply a toner or astringent. Here again, they need to do that safely. It could be on a cotton ball or a cosmetic round if that's the way that you've taught them to utilize that. If they spray, they do have to cover the eyes. That could be with just the hands, and they could spray that astringent or toner or tonique. If they could put a cotton round pad or butterfly eye pad there, if that's the way that you've taught. We will here again pretty much examine. We just want to make sure that we are protecting the eyes, and we will examine that accordingly. We're always looking to see that items to be disinfected, soiled linens, and trash are disposed of in the proper manner throughout that section. Now, if everybody has stepped back to indicate that they've completed that task, our proctor will say, all candidates have indicated they've completed this section of the examination. We will now proceed. But if people are still working and the timer hasn't gone off, when that timer does go off, our proctor will say, please stop working. At that point, that candidate should do just that, step back and wait for further instructions. The next section is a 10-minute section. It's exfoliating the face with product using implement or materials, including towel steaming. It is a 10-minute procedure, as I said. Candidates are given the following verbal information. You will perform exfoliating the face with product using implement or materials, including towel steaming. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. The instructions are repeated, and candidates are told you may begin. Our examiners are looking to see that the exfoliation supplies are labeled in English, that the implements and supplies are visibly clean, and then we want that candidate to apply the exfoliating product over the face and manipulate with some sort of implement or material, excluding the eyes and the mouth. Now, we know that there are exfoliations for the eyes or the eyelids, and we know that there are exfoliation for the lips. This is an entry-level exam, and we're asking our candidates to avoid those two areas. Now, when we talk about using an implement or material, you may teach candidates to maybe use a facial brush. That's certainly acceptable with us. The others teach us to exfoliate the face with a loofah or a gauze or a 4x4. We will even allow a Clarisonic or a battery-operated brusher in this because we know that a lot of the schools are teaching with that. Now, we're asking them not to bring the big brushing machine, but a handheld battery-operated apparatus we would allow for exfoliating the face in our aesthetics exam. Afterwards, a steam towel is to be applied and removed. Let me talk about that for just a second. I would encourage you to go ahead and have that steam towel in a bag or a Ziploc bag sort of thing. You could even put it in a thermos, and I would suggest that it already be wet. There is water facilities there, but at the same time, if you can avoid doing that, you're much more prepared and you don't have to stand in line or to look for a sink to wet your towel. The proper procedure, of course, in using a steam towel in all of our textbooks is we are to squeeze the excess water from that towel. We're always to test the temperature of that towel on the wrist or the forearm, and then we're to apply that towel over the face, making sure that the nose and or the mouth are not covered. Afterwards, we want to lift that from the face, not dragging or pulling it, and then we're going to put that in, of course, our soiled linens at that time. Afterwards, we want that candidate to remove the residual product. That could be here again, like I said, with a sponge. It could be with a cotton round or a cotton cleansing pad. But at the same time, I realize some of you folks may be teaching to use that steam towel to remove the product. So if that's the way that you teach, they wouldn't have to do that extra step. They could go ahead and use the steam towel, and as they remove it, go ahead and remove the exfoliant or residual material that was left on the face. We would be, of course, looking to see that items to be disinfected, soiled linens, and trash would be disposed of in the correct manner throughout that section. If everybody has stepped back to indicate that they've finished, our proctor would say, all candidates have indicated that they've completed this section of the examination. We will now proceed. Our next section is massaging the face with product. It is a 10-minute procedure. Candidates are given the following information. You will perform massaging the face with product. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. The instructions will be repeated, as they always are, and then our candidates are told, you may begin. Your examiners will be looking to see that the massage products are labeled in English, that any implements and supplies are visibly clean, and that they distribute the massage product over the face. They will be expected to demonstrate the effleurage, the petrissage, the tapotement or tapement, and the friction movement, 4 of the 5 basic massage manipulations that estheticians are taught. Here again, in no special order, our examiners will adjust themselves and position themselves so that they can see all of the candidates. After they have gone through that massage process, we will expect that candidate to remove the massage product the way that you've taught. If all candidates have stepped back to indicate they have completed that section, our proctor will say, all candidates have indicated that they've completed this section of the examination. We will now proceed. Then our candidates are told, you will have 5 minutes to break down and properly dispose of supplies used in the previous sections of this examination. You will be informed when you have 2 minutes remaining. Do not set up or demonstrate any services until the verbal instructions have been read and you are instructed to begin. Step back to indicate you have finished. The instructions are repeated. So let's stop and talk about that for just a minute. At that point, I need to put away all of the things that I'm not going to use throughout my examination. Things like my universal supplies. And a universal supply to me, and that may vary from candidate to candidate or from school to school. Universal supplies would include, of course, that first aid kit. It would include that disinfectant and that hand sanitizer. I might like astringent and use astringent a lot, so I might have my astringent or toner or tonique as a universal supply. I like a roll of paper towels there, so that would be a universal supply for me, as well as a box of tissues. I like to use those occasionally to blot any excess, and I would use those. So any of those universal supplies, I would push to one side. At that point, I would get rid of all the other things that I had used previously. I no longer need that exfoliant. It would go into items to be disinfected. Because Sean mentioned to you earlier, we have no single-use products in our examination. So that would be a product that would have to be disinfected prior to use again, wouldn't it? I'm not going to be needing that. That brush has gone away. My towel has gone away. And even the towel that I may have placed on my work area would have gone into soiled linens. After getting rid of all those supplies, I would step back and wait for further instructions. The next thing that candidate would hear would be you will prepare your work area for a new client. You will also prepare your client for services. You will set up the universal supplies that you will use for the remainder of the examination. You will also set up for the following sections of the examination: hair removal of the eyebrows by tweezing and simulated soft wax, microdermabrasion, facial mask, facial makeup, and lash enhancement. You will be expected to follow all client protection, safety, and infection control procedures. You will have 15 minutes to complete this section. You will be informed when you have 8 minutes remaining. Step back to indicate you have finished. The instructions are repeated, and the candidates are told, you may begin. So let's talk about that. I've pushed my universal supplies to the side. I, of course, need to get rid of the décolletage towel that I used previously. That would go into soiled linens. I needed to undrape my client. That would have gone, if it were a plastic cap, that would have gone into the trash. Were it a towel or a turban that could be washed and sanitized, then certainly that would go into soiled linens. Okay, I need to pull out those new supplies that I just listed, but I need to disinfect that area first. So I'm going to disinfect my work area that may be over on my right. I'm going to bring out those new supplies and put over there on that area that has been disinfected. And then I'm going to move those universal supplies, that hand sanitizer, that disinfectant, and I'm going to disinfect those and place those too on the newly disinfected area. After that, and everything has been removed from over on my left, I'm going to go ahead and disinfect that work area. If I used a paper towel to disinfect with, that would go into the trash. If I had used a cloth, that would go into soiled linens. Okay? So then we're ready to set up. I step back, and then I wait for further instructions. Here again, a typical setup. Your examiners are looking to see that they disinfect all work areas completely with product that's labeled in English, that they sanitize their hands with product that's labeled in English, and that the universal supplies are labeled in English. We want to see that they apply new protective covering to the model or mannequin, both the hair and the body, and that items to be disinfected, soiled linens, and trash are disposed of in the proper manner. If everybody has stepped back, our proctor will say, all candidates have indicated they've completed this section of the examination. We will now proceed. And our next section is the hair removal of the eyebrow by tweezing and using simulated soft wax. Candidates are told, you will perform the hair removal of the eyebrows by tweezing and using simulated soft wax. You will demonstrate hair removal from one eyebrow by tweezing. You will demonstrate hair removal from the other eyebrow using simulated soft wax. You will be expected to follow all client protection, safety, and infection control procedures. You will be instructed individually by the examiner to demonstrate the tweezing and soft wax procedures. This is an untimed section. Do not begin hair removal until you are instructed to do so by the examiner. The instructions are repeated. Once those instructions are repeated, our examiner is going to walk up to your candidate and they're going to say to that candidate individually, please demonstrate hair removal of the eyebrow by tweezing. Your examiner is looking to see that those hair removal of the eyebrow supplies are labeled in English, that any implements and supplies are visibly clean, and that that candidate wears gloves. We want to see them apply antiseptic to the eyebrow area that they're about to tweeze. And then holding the skin taut, we want to see them demonstrate tweezing in the direction of the hair growth. Once they've completed that, that tweezer needs to go into items to be disinfected, and we want that candidate to apply antiseptic to the area that was just treated. Now, to that same candidate, our examiner will stay, and they will say, please demonstrate hair removal of the eyebrow using the simulated soft wax. What your examiner is looking to see is that they apply antiseptic to that eyebrow area as well. And because they're about to wax, they use some type of absorbent material or product to dry the eyebrow area. Many times that's a tissue. Sometimes it's a towel or a paper towel. We even see sometimes that they might bring in cornstarch or talc to dry that area. And certainly all of those are methods that are acceptable. At that point, we want that candidate to take a spatula, go into that simulated soft wax. That simulated soft wax, you might want to send honey. Sometimes people will send petroleum jelly, molasses, any of those items like that that might simulate soft wax. And then we want to see them take on a spatula, a small amount of that. We want them to test the temperature on the wrist or the forearm there, and then dispose of that spatula. Certainly if it were a wooden one, it would go into trash. If it were a plastic, it could be possibly disinfected and go into items to be disinfected. Then we want to see them take another spatula and get that wax and apply that simulated wax along the entire length of the eyebrow, certainly in the direction of the hair growth. Then we want to see them smooth the wax strip. I'm not sure if you're teaching using Pellon or if you're teaching using muslin or you're teaching using plastic, but any of those methods or supplies are acceptable. We just want them to smooth that strip over the simulated wax product. We want them to hold the skin taut, meaning without slack, and remove that wax strip in the opposite direction of the hair growth. Afterwards, we want to see them apply antiseptic to that area as well as a post-epilation product. At that point, the examiner will tell your candidate, please step back and do nothing until the next verbal instructions are given. At that point, they'll move on to another candidate. They will go through and make the assessment there. And then when everybody's finished, the next verbal instructions that they will hear would be from our proctor saying, all examiners have indicated they are ready to proceed. And the next section is the particle microdermabrasion. It is on the forehead. It is a 10-minute procedure. Candidates are told, you will perform particle microdermabrasion. You will demonstrate vertical and horizontal strokes on the forehead. You will be expected to follow all client protection, safety, and infection control procedures. You'll have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. The instructions, as always, are repeated, and our candidates are told, you may begin. Your examiner is looking to see that the microdermabrasion supplies are labeled in English, that any implements and supplies are visibly clean and free of dirt and debris. Then we want to see that candidate apply a degreaser or some type of prep solution to the forehead, and then dry that excess moisture. They'll need to apply eye protection to the mannequin. That could be in the form of a cotton round. A lot of times candidates may put on a pair of sunglasses over the top of that cotton round to help hold it in place. Some of you folks are certainly teaching to use the butterfly iPad for that case. That is not a problem. Then we want to see that the candidate wears eye protection and a mask that covers both the mouth and the nose. We want to see that candidate wear gloves, and then we want to see that candidate hold the skin taut as they demonstrate microdermabrasion across the forehead. They will be demonstrating vertical strokes with a simulated handpiece across the entire forehead, and there must be a cord that's attached to that handpiece. Sometimes we may see a pencil where they're using the eraser end to go across that mannequin, and it has a piece of 4-foot cord, a string, or a twine attached to it. Sometimes it's a magic marker that's certainly closed up, but it has a 4-foot cord that's also taped to it. Sometimes we actually see a true handpiece come in. And here again, we are asking only for the vertical and the horizontal strokes. We know that one of our textbooks now says that there is a diagonal stroke, but we're just looking for both the horizontal as well as the vertical strokes. After they've done that procedure, we want them to go through the process of removing particles from the treated area, even though we know that's simulated. Sometimes that's with a brush. Sometimes that is with a round cotton ball or a cotton pad, but just go through the process of showing us, or that examiner, that you know that there are particles there and that you are going through the process of removing those from that mannequin. We'll, of course, be looking to see that items to be disinfected, soiled linens, and trash are disposed of in the correct manner. Our next section is the facial mask and the conclusion of the facial service. It is 10 minutes. Candidates are told, you will apply the facial mask and conclude the facial service. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. Instructions are repeated, and candidates are told, you may begin. Your examiner is looking to see that the facial mask supplies are labeled in English, that implements and supplies are visibly clean. We want to see them apply the mask to cover the face, excluding the eyes and the lips. Here again, we know that there are masks for the eyelids. We know that there are masks for the lips. We are asking that candidate to avoid those areas. If they get some on the eyelids or they get some on the lips, they've got all kinds of apparatuses to remove that, tissue, cotton ball, cotton round, cotton swab, however they want to do that, just remove it off the eyelids and remove it off the lips. I would encourage you to send a mask that can be seen by the examiners. A clay mask works very, very well. Gel mask can hardly be seen. And so I've been asked to make sure that they can see that mask. So send a clay mask. They don't have to wait a 10-minute period or a 15-minute period. They're just going to put that mask on, and then once they've completed that, then they're going to, of course, go ahead and remove that mask. After removing, we want that candidate to apply astringent or toner or tonique. As I mentioned earlier, if they're going to use a spray, they do have to protect the eyes. Then we want to see that candidate apply moisturizer. We will be, of course, looking to see that items to be disinfected, soiled linens, and trash are disposed of in the correct manner. The next verbal instructions that a candidate would hear would be, all examiners have indicated that they've completed this section of the examination. We will now proceed. Here's a picture of a pretty good mask. It took a little longer to do, but it is certainly visible, and it is certainly avoiding the eyelids as well as the lips. Our next section is the facial makeup. Candidates are told the following information. You will apply facial makeup. You are expected to brace when working around the eye and the mouth areas. Let me address that again. We know that our textbooks left that out. All three of the textbooks actually left that safety procedure, and that's really the main thing that we're concerned about in applying makeup is the safety of the application. We're not looking to see if that mannequin is a spring or they're a winter or fall or any of those things. We're just looking to see that that candidate knows how to apply makeup and to do it safely. So they do need to brace anytime working around the eyes. The subject matter experts that wrote this exam felt that it would be unfair to examine on it if we didn't tell a candidate that we were expecting it. And so we are expecting them to brace anytime they're working around the mouth area or the eye area. They're told they will have 20 minutes to complete this section, and they will be informed when they have 10 minutes remaining. Step back to indicate you have finished. The instructions are repeated, and the candidates are told you may begin. You can see here at the top left is a single brace. The bottom right is a double brace where there are 2 points of contact. We are not asking for a double brace. We have a couple of states that it is their state law that they double brace anytime they're working around the eyes or the lips, but we're asking for at least a single brace, but you may opt to use a double brace. But no freehand work when working around the eyes or the mouth. Your examiner is looking to see that the facial makeup supplies are labeled in English, that the implements and supplies are visibly clean. Let me talk about implements and supplies briefly. They will have to remove those products from their container and place them on a receptacle or pallet. They can go and buy a $1.19 pallet if they would like. They can bring in a paper plate, a foam plate, a porcelain plate, but they have to transfer that product, that foundation, those blushes, their eyeshadows, etc., from the original container onto a pallet. I would encourage you here again to send disposable applicators, brushes, etc. Sean mentioned earlier today that if it has a wooden handle, it has to go into the trash. If it has natural bristle brushes, it has to go into the trash. So make sure that, or I would send disposables, a couple of places where we're looking at, for instance, mascara or the lip brush. They have to be disposables. There can't be retractable lip brushes used in this examination. So I would get into the habit of going ahead and letting candidates use disposables, get them accustomed to it, and they'll be fine in this exam. The next thing that the candidate should do, of course, is to apply protective covering to the shoulders. That could be that décolletage towel that they have been using in the previous section of the exam. They could bring in a makeup cape, but we just want them to indicate to us that they realize that we are about to use powders and things may be falling down, and they're going to protect their client from those powders. We want them to secure the hair away from the face. That could be with a headband or it could be with a towel, however you're teaching them. Then we want that candidate to apply foundation to cover the face. We want them to apply powder to the face and apply blush. We do want them to groom the eyebrows in some manner. That could be just by brushing those eyebrows on that mannequin, and we realize that there are not real eyebrows there, but indicate to your examiner that they are grooming the eyebrows. They could use a pencil if that's the way that you're teaching them to do. They could use a comb if that's the way that you're teaching them, but just groom the eyebrows or address the eyebrows in some manner. We want to see that candidate apply eyeshadow and apply eyeliner. They can certainly use a pencil. Sean mentioned earlier, everything in the kit we assume is clean and ready for use. They don't need to show the examiner that they are going to sharpen that pencil. We didn't even say that they had to use a pencil. If they wanted to use a liquid liner, certainly they have to use a disposable brush for that liner. Want to see that candidate apply mascara. We also want to see them use lip liner and lip color. Now they can take that tube of lipstick, take the top off. They can take a wooden tongue depressor or a spatula, a popsicle stick, scrape a little bit of that color on there, close that, and that popsicle stick or that tongue depressor has now become their palette. They can work back and forth as many times if they'd like without having to chunk a big chunk out of the lipstick. We will, of course, be looking to see that items to be disinfected, soiled linens, and trash are disposed of in the correct manner throughout that section. If everybody has stepped back to indicate that they have finished, our proctor will say, all candidates have indicated they've completed this section of the examination. We will now proceed. And the next section is the eyelash enhancement. Candidates are told, you will apply eyelash enhancement. You are expected to brace when working around the eyes. You will add a complete eyelash band to the full length of the lash line of both eyes. I tried to stress that because your examiners were telling me that it needed to be stressed to you. So make sure that they're doing that to both eyes. You will be expected to follow all client protection, safety, and infection control procedures. You'll have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. The instructions are repeated, and candidates are told, you may begin. Your examiner is looking to see that the eyelash enhancement supplies are labeled in English, that any implements and supplies are visibly clean, and that they brush the lashes in order to remove any foreign matter. Now here again, that would be a mock demonstration because we know that your mannequins don't have lashes, but just indicate to us that you know to cleanse the lashes, just like our textbook says, by brushing them and removing any foreign matter that might have been there. Then we want to see that candidate measure and cut the band to the appropriate length, certainly prior to applying it to the mannequin. Want to see them apply adhesive to the band, and then apply the band starting at the inner corner of the eye, meaning near the nose, and work following that natural lash line all the way out. We will be, of course, looking to see that items to be disinfected, soiled linens, and trash are disposed of in the correct manner. While I'm taking a breath here, you can be sending questions if you have things that I haven't addressed to nancy.harlow@dca.ca.gov. Our estheticians will have a blood, or have had and will continue to have, a blood exposure procedure. It is an untimed section, and they're given the following information. You will demonstrate the blood exposure procedure. You'll imagine the following scenario. During a service, your client has sustained a minor cut to the forehead. The injury is such that you can continue with the service. You've not come in contact with the blood, and your work area has not been contaminated. You are expected to demonstrate the proper procedure for a blood exposure. You will be expected to follow all client protection, safety, and infection control procedures. Do not remove materials from the first aid kit until you are instructed to do so by the examiner. And then at the end, the instructions are repeated, and then they're told, please demonstrate the blood exposure procedure for this scenario. They're looking to see that the blood exposure supplies and materials are labeled in English, that they remove materials from the first aid kit, that the supplies and the materials are visibly clean, that that candidate wears gloves, and that they cleanse the injured area with antiseptic, they cover it with a dressing, and they dispose of contaminated supplies. I sort of sped through that because I want to talk to you about it. What we're looking for in this exercise is for that candidate to sanitize their hands. We want them to go into that first aid kit that is labeled as a first aid kit, and we want them to retrieve the things that they need for a blood exposure. That would include a pair of gloves if they were not already out on the table. That would be a zip container or a baggie that could be closed or zipped shut. It would be a cotton round, possibly. It could be an alcohol wipe or an antiseptic wipe. We want them to remove those supplies out of there and close that kit. We want them to don those gloves. We want them to open, if they pulled out a cotton round or a cotton ball, they could use their hand sanitizer because it's an antiseptic as well, and we want them to cleanse the forehead. They might, if they didn't pull out a cotton ball or a cotton round for that purpose, they might open that cosmetic wipe. That's antiseptic wipe, that alcohol wipe, and cleanse the forehead area. They, of course, would need to put the wrapper as well as the wipe itself into the Ziploc bag, wouldn't they? And afterwards, we want them to take a bandage. We want them to open up that bandage, put that too into that baggie that's going to be closed in just a minute. And then we want them to apply that bandage on the forehead, putting the strips themselves that are held on the sticky part there in the Ziploc bag as well. We want them to remove those gloves, put those in that Ziploc bag, zip it up, and just drop it into the trash. It doesn't need a biohazard. We prefer that it not have. If it has a biohazard label on it, it cannot be placed. It needs to be placed on the table, on the workstation, and not put into the trash. Here again, once they're finished with that, that is the examination. They're told to clean up. If you have questions, you can write us at nancy.harlow@dca.ca.gov. We're going to take a 5-minute break, and I'll come back and answer those questions that you might have. Thanks for staying along with us, and we'll see you shortly. Hi, thanks for joining us back. I'm Don, and I'm going to be spending the next few minutes talking about our nail technology exam. We did get some questions about cosmetology during our break, and we'll be addressing those at the end today. So if you have a chance, stick around. And I'm going to go through the nail technology examination program for you right now. Our candidates are in place. They're excited about getting started, and they'll be hearing the following information. You will prepare and set up your work area for your client. You will set up the universal supplies that you will use throughout the examination. You will also set up the supplies for the manicure and polish application. You will be expected to follow all client protection, safety, and infection control procedures. You'll have 15 minutes to complete this section. You will be informed when you have 8 minutes remaining. Turn the hand toward the examiner to indicate you have finished. The instructions, as always, are repeated, and the candidates after that are told, you may begin. Your examiners will be looking to see that they disinfect all work areas completely with product that's labeled in English as an EPA-registered hospital-grade disinfectant. Let me address that just in case you just joined us. We do expect it to be a hospital-grade disinfectant, and it does need to be in English, and it does need to be in a real product. Sean addressed that earlier, as well as our hand sanitizer needs to be a real product, and it too must have a manufacturer's label. We will be expecting the universal supplies to labeled in English. Items to be disinfected, any soiled linens and trash are disposed of in a correct manner. Let me stop and just talk for just a second. Very common for nail technicians to come in, disinfect that work area, and then a lot of times they're taught, go ahead and put a towel there. It's certainly permissible with us to put that towel down. Sometimes we see them even put a paper towel over that. Sometimes they might even bring a little cushion for that hand to help prop it up. We're really looking to see that they disinfect the work area. The other things are fine, and we have no issues with those. If everybody has turned the hand toward the examiner, our proctor would say, all candidates have indicated they've completed this section of the examination. We will now proceed. But if the timer hasn't gone off and there are people still working, as always, when that timer does go off, our proctor would say, please stop working. This is a typical setup. We see this many times. You see that the area has been disinfected. You see the disinfectant there. You see a roll of paper towels. You see some files. You see their polish, and they did go ahead and put the towel down as well as a paper towel. I see their manicuring brush as well as the manicure bowl. That candidate, or those candidates, are given the following information. You will now perform manicure and polish application. You will be expected to follow all client protection, safety, and infection control procedures. We talked about infection control earlier, so if you missed that part, scan back and look at it again. You will have 20 minutes to complete this section. You will be informed when you have 10 minutes remaining. Turn the hand toward the examiner to indicate you have finished. The instructions are repeated. Candidates are told, you may begin. You can see a diagram here of holding a finger. We do ask that when they're filing, they have at least one finger held at the sidewall. Our textbook used to say 2. It only says 1 now, so we are expecting them to hold the finger from underneath and have one finger at the sidewall in order to pull that skin down to keep from damaging that hand. Your examiner is looking to see that the manicure supplies are labeled in English, that any implements and supplies are visibly clean without dirt or debris. And then we want them to sanitize the hand to be manicured with product that's labeled in English. Now, I know that you're teaching infection control, and I know that you have also taught them to sanitize their hands before they would touch or sanitize that manicure hand or that hand to be manicured. We want to see that candidate shape the free edge in order to establish a uniform shape and length. Here again, that's the way that you're teaching. I'm sure that you're teaching them to hold that hand properly. I know that you're telling them not to seesaw back and forth. That mannequin hand should have a set of nails prior to arriving to the site. A manicure could take place if they had tips already. Without that, they're going to have some issues. After they've shaped the free edge in order to establish a uniform shape and the uniform length, we want to see that candidate immerse all fingernails in a bowl of water. They do need to have that water. There is water on the site. If they bring water, it's certainly fine with us, but it needs to be labeled because it will be considered as a product. I mentioned earlier that we have no single-use products in our exam, and Sean also mentioned earlier today that there are no aerosols allowed in our exam. They do need to immerse all fingernails in a bowl of water. That could be done by doing 4 and then 1, or 1 and then 4, or bringing a bowl other than the typical plastic manicure bowl that would accommodate all 5 fingernails. After they have immersed those into a bowl of water, we want to see that they apply cuticle remover, and we know that you're teaching them to do that following infection control and not touch the tip of that nail plate or the tip of any containers. I want to see that candidate push the cuticle back. Now, we do expect new files in this exam, but we will allow an orange wood stick. They could push the cuticle back with an orange wood stick if they so desired. If you're teaching them to use that plastic pusher with the red rubber tip, that would be fine as well as a metal pusher too. After they have pushed the cuticle back, we want to see that candidate cleanse under the free edge. They, of course, need to wrap that applicator with cotton. Want to see the candidate brush or wipe the nails in order to remove any debris. And then we want to see that candidate buff the nails and then follow that up with cuticle oil. I would encourage them to use a dropper. They can't use the brush out of a cuticle oil. If they decide to bring that particular item, they can set the brush aside, get another disposable or a cotton swab and get some oil out of there. But if they need additional, they'll have to get another applicator as well. Replace the top and go about their business. Then we want to see the candidate apply massage product. Once that's been applied, we want to see them massage the fingers, the top and the palm of the hand, demonstrating at least 2 massage movements or massage manipulations, the effleurage, the petrissage, the tapotement, or the friction. Afterwards, we want to see them cleanse each nail plate with an appropriate solution to remove that massage product. And then we want to see them apply a base coat, a red polish, and a top coat. I want to address that for a minute. When we say we want a red polish, we're talking about red polish, fire engine red. We're not looking for a shade of red. We're not looking for a tint of red. We're looking for red polish. As far as our base and top coats, we know that many times that those now are dual purpose. You may have a product that is both a base and a top coat. That is certainly admissible in this exam. If it says base/top on the top of that or on that bottle, we assume that that is the product that is in there. And then if everybody after polishing has turned their hand toward the examiner, our proctor would say, all candidates have indicated they've completed this section of the examination. Please do nothing until the next verbal instructions are given. At that point, our examiner is going to go over, and with a gloved hand, they're going to pick up that hand and they're going to make their assessment. They're looking to see that that polish is smooth and that it's even. They're looking to see that the nail plate is entirely covered with red polish and that the cuticle and the surrounding skin are both free of polish and free of injury. They'll turn that hand back to the candidate and place it back on their work area, and they'll tell that candidate, please do nothing until the next verbal instructions are given. They'll go to the next candidate, make their assessment there until everybody has been examined. The next thing that they would hear would be that all examiners have indicated that they are ready to proceed with the examination. Then they're told, you will have 5 minutes to remove the polish from all nails and properly dispose of supplies used in the previous section of the examination. You will be expected to follow all client protection, safety, and infection control procedures. You will be informed when you have 2 minutes remaining. Turn the hand toward the examiner to indicate you have finished. As always, our instructions are given again, and then our candidates are told, you may begin. Now, during this process, we are looking to see that they do remove the polish from the nails and how they do it and what they do with those supplies that they have used for removing that polish. And then we're also expecting them to dispose of any items that they've used previously. When I showed you the picture of the towel and the paper towel, that would mean that that paper towel would go into the trash, that cloth towel would go into soiled linens. They would push the universal supplies to the side. They're no longer going to need the red polish or the base coat or top coat, so that would go into items to be disinfected because we said we don't have single-use products in our examination. Anything else that they might not need, that cuticle remover they would no longer need, that manicuring bowl would go into items to be disinfected, etc. Then they'll be given the following information. You will prepare your work area for a new client. You will set up your work area with the universal supplies that you will use for the remainder of the examination. You will also set up for the following sections: nail tip application and blending and sculptured nail. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Turn the hand toward the examiner to indicate you've finished. The instructions are repeated. Candidates are told that they may begin. Let me interject something here that we haven't always done in the past, but we will allow a lap towel. We know that many of you are teaching to use a lap towel. Sometimes it protects the covering or the clothing of that particular candidate. So when they have finished with that exercise and they're to remove the items that have been used, that lap towel too would go into soiled linens. If it were cloth, if it were paper, certainly then it would go into the trash, and then they could retrieve and put on a new one for the remainder of the examination. Your examiner is looking to see, here again is a typical setup. I see your first aid kit, I see a roll of paper towels. I see items to be disinfected. I see some adhesive and some tips and damping dishes and other supplies there. I also happen to see a cloth towel. Then she's also placed a paper towel over the top of that. Your examiner, like I said, is looking to see that the minimal that they do is to disinfect the work area completely with product that's labeled in English, that they sanitize their hands with product that also is labeled in English with a manufacturer's label, and that the universal supplies are labeled in English. We will be looking to see that items to be disinfected, soiled linens, and trash are always disposed of in a correct manner throughout a section. If all the hands have been turned toward the examiner, our proctor will say, all candidates have indicated they've completed this section of the examination. We will now proceed. But had the timer not gone off and people were still working, when that timer does go off, our proctor would say, please stop working. Our next section is the nail tip application and blending. Candidates are given the following information. You will now perform a nail tip application and blending. You will be expected to follow all client protection, safety, and infection control procedures. You will apply a nail tip to that will be determined by the examiner that day, or the proctor that day. You will have 20 minutes to complete this section. You will be informed when you have 10 minutes remaining. Turn the hand toward the examiner to indicate you have finished. Instructions are repeated, and the candidates are told you may begin. Your examiner is looking to see that the nail tip application and blending supplies are labeled in English, that the implements and supplies are visibly clean. Now, this is a new client, so we should have new files and new buffers and possibly an orange wood stick if we desire to use one for this portion of the exam. We want to see them sanitize the mannequin or model hand with product that's labeled in English, and certainly they need to sanitize their hands prior to sanitizing that hand. We want to see them remove any residual nail polish from the nail plate with an appropriate solution and remove the shine from the nail plate. After they've removed the shine from the nail plate, we want to see them remove the dust from the nail plate. That could be with merely brushing it off with a manicure brush or another brush, or wiping it off with a cotton ball or a cosmetic round. And then we want to see that candidate apply some type of nail dehydrator product to the nail plate. They then need to select a full well tip and attach it to the finger that was assigned by their proctor. Once it has been attached to the finger, they need to trim and shape the nail tip, and they need to blend and finish that nail tip. Once everybody has completed that process, they'll turn the hand toward the examiner. When all those hands have been turned, our proctor will say, all candidates have indicated that they have completed this section of the examination. Please do nothing until the next verbal instructions are given. At that point, the examiner is going to go over with a gloved hand. They're going to pick up that hand that the tip was just applied to, and they're going to make their assessment. They're looking to see, of course, that the result of the nail tip selection and application, that it is secured, that there are no bubbles underneath between the nail tip and the nail plate. They're looking to see that it is blended well, that there's no adhesive there. They're going to feel the free edge of that nail to make sure that it's nice and smooth. They'll be looking to see, is it square on one side and round on another? They're looking, of course, to make sure that it's a good finished nail. At that point, they'll turn the hand back toward the candidate. They'll say, please do nothing until the next verbal instructions are given. At that point, they'll move to the next hand. They will pick that up, assess that, until everybody has been assessed. They, of course, will be looking to see that items to be disinfected, soiled linens, and trash are disposed of in a correct manner. The next thing that candidate would hear would be, all examiners have indicated they are ready to proceed. And then they're told the next section is a sculptured nail. You will sculpt a nail on the finger to be determined by the proctor. You must use no owner product. You will be expected to follow all client protection, safety, and infection control procedures. You'll have 20 minutes to complete this section. You will be informed when you have 10 minutes remaining. Turn the hand toward the examiner to indicate you have finished. The instructions are repeated. Candidates are told they may begin. We will be looking to see that the monomer, the polymer, and the primer must be in the original container and must be contained or closed by the manufacturer. We'll be looking to see that implements and supplies are visibly clean and that they remove the shine from the nail plate. Okay, so I just said that the monomer, the polymer, and the primer must be in the original container, and it must be factory sealed. So make sure that you're sending products that are that, just that. Then, after removing that shine from the nail plate, we want to see that candidate cleanse and dehydrate the nail plate, and then fit a form to fit snugly under the free edge. Now, you may be teaching to use a paper form, and that's certainly fine with us. Others of you teach to use the metal form, and that's fine with us. And then certainly there's always the plastic form. We're going to examine what you are teaching, and we're just looking to see that that form does fit snugly and that it fits on each corner of the free edge. And then after applying that form, that candidate applies a primer to that nail plate. We will be expecting that candidate to sculpt a nail in order to extend the free edge of the assigned finger, and it needs to be on that assigned finger. Let me address our product here again. We're not looking for a particular color. We know that there is the French manicure with the pink and white. We know that there's the clear, there's just the pink or just the white. We're expecting that candidate to sculpt a nail in which you have taught them, in the manner in which you have taught them. I do want to mention again, it does have to be no odor product, and it must be factory sealed. Once that's gone through the polymerization process, our candidate is going to sculpt that nail, they're going to shape and contour and finish that sculptured nail. Once they're through with it, they're going to turn it toward our examiner. Our examiner will be waiting until everybody has completed that section. When everybody has completed, our proctor will say, all candidates have indicated they have completed this section of the examination. Please do nothing until the next verbal instructions are given. At that point, the examiner is going to go over, and with their gloved hand, they're going to pick up that hand, and they're going to make a good assessment. They're looking to see if it has a nice arc there. Is it tapered? Does it have pit marks or potholes from overfiling? Is it blended down into the tip so that it's down into the nail plate? They're looking to see if there's sculptured material on the surrounding skin or on the hyponychium or on the cuticle area. So they're just looking for a good sculptured nail. It should be smooth, balanced, and even, and certainly here again, that skin that surrounds the nail should be free of product. They'll turn that hand back to the candidate and say, please do nothing until the next verbal instructions are given. Then they'll go and assess the next one and the next one until everybody has been assessed. Once everybody has been assessed, they'll be told all examiners have indicated that they have completed their assessment and are ready to proceed. And then we have our blood exposure procedure. Candidates are told, you will demonstrate the blood exposure procedure. You will imagine the following scenario. During the service, your client has sustained a minor cut to the thumb. The injury is such that you can continue with the service. You have not come in contact with the blood, and your work area has not been contaminated. You are expected to demonstrate the proper procedure for a blood exposure. You will be expected to follow all client protection, safety, and infection control procedures. You'll have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. The instructions are repeated, and candidates are told you may begin. And just like in the aesthetics exam that I talked about previously, it is the same process, but instead of applying it to the forehead of the mannequin for aesthetics, we'll be applying it to the thumb of the mannequin hand. We are looking to see that the blood exposure supplies and materials are labeled in English, that they remove the materials from the first aid kit with a sanitized hand, and that the supplies and the materials that they remove are visibly clean. We'll be looking to see that that candidate wears gloves and that they cleanse the injured area with an antiseptic. And certainly that should go into their contaminated supply bag and then cover with a dressing that is absorbent and secured That wrapper itself, too, should go into the bag that's going to be disposed of. Their gloves come off, those go, it's zipped, and it's thrown into the trash. Then they're told, please do nothing until the next verbal instructions are given. One thing I failed to mention to you that your examiners asked me to please remind you of, and that's that once they have completed the sculpturing process and they're through, and they must pour that monomer and those powders into a damping dish, once they're finished with sculpting that nail, it needs to be covered prior to filing. And certainly it shouldn't be left over until we get into the blood exposure procedure. So after they finish sculpting the nail, they need to cover the damping dish. That could be with a cotton round. It could be with a paper towel. Any manner that sometimes we know they even use a marble. Whatever that they have decided to use, but that damping dish should be covered prior to filing and certainly by the time that they get to the blood exposure procedure. Our candidates are then, that does conclude the examination. Our candidates are told that they will clean up and take all the supplies that they have utilized during the examination with them. We'll be taking a 5-minute break. During that time, you can be sending us questions. Here again, nancy.harlow@dca.ca.gov. And during that time, that 5-minute period, that we will try to answer those questions that you might have. Afterwards, when we come back, we'll answer those questions. And if there are no questions, certainly then we'll be going on to electrology for those of you who are interested. Thank you for coming back with us. We did get a couple of questions for nails and a couple for aesthetics. Let me just hit you with a couple of the nail questions. For sculpting nails portion in the cosmetology exam, is applying nail polish also tested? And the answer to that is no. They will only be doing the sculptured nail section there, but not the polish application. I would also like to remind you, during the second setup, we've told you to pull the supplies that you're going to need for the nail tip application, as well as the sculpturing portion of the exam. Please do not pour your monomer into the damping dish until it is needed for the sculpting nail section. There's no need, there's a possibility of it spilling or somebody bumping it, and so it would be advisable to wait until you need that particular monomer until you need it. I did have a couple of questions also. Will the cosmetologists do their facial in the exact format as estheticians? I would say please go to the California website, download the CIB, and it will give you the exact thing that you need to be doing for the California exam. I have another question. When do the candidates clean up the mannequin head and the tripod before set up for the facial or the sculptured nail? They will be given 2 minutes to remove the supplies from their kit for the sculptured nail portion of the exam or for the facial portion of the exam. They can certainly do that during that time period and then go ahead and set up for either the sculpture or the facial. An esthetician question. Can the esthetician use small disposable cups instead of a palette to scrape their makeup into? Yes, we have no issue with that at all. We must visibly see them scrape that or remove that from that container into their small cups. What we don't want is them going to one of the hamburger places and getting all these little tiny cups and coming back with something labeled as powder and another is foundation, and then throwing all of those away. We have no single-use products, so if they come in and they want to pour it into a cup and work from there, we have no problem at all, but they just can't bring it. It has to be treated as a multi-use product. Are the students able to place all makeup products on the palette during the setup, or does it have to be done in order of application? We don't have a particular order of application. We've asked them to do makeup We know that it's very common after foundation and maybe translucent powder that many makeup artists or estheticians do the eyes. Others like to start at the cheek. Others start at the lips. So we're not looking for any particular order. And certainly they may go ahead and place it onto their palette if they would like. That's not always a good idea because candidates many times are nervous and they get to shaking, and that palette may wind up in the floor and they've lost the majority of their products there. So I would suggest that they just pour them or scrape them out as needed, but any of those are fine. I have another question concerning aesthetics. After cutting the first lash, do they have to lay the scissors down on the work area, or can they cut both at the same time? They certainly may cut both at the same time. We don't have an issue with that. Here again, they may lay those on the work area if they would like as well. Can cotton be laid out for each procedure, or do the students need to have a cotton bag and use them as needed? That's entirely up to the candidate. We don't have a problem with that. Can the esthetician candidate remove the head and the body covering from the doll head during the 5-minute breakdown? And absolutely yes. That should happen during that. We are told to remove the supplies that we've used previously in the exam. That was probably my fault for not stressing that to you. But anyway, go ahead and remove the décolletage towel and the mannequin protection for the hair and dispose of those appropriately. I think that's all the questions I have. Sean's going to come up because there were a couple more questions that came about from cosmetology, and he'll be answering those.
Okay, a couple more questions came in. The color bowls that you leave on the station, how do you cover them? Saran wrap, foil, or does it have to be a lid? I would highly recommend for transportation purposes that it is a lid. I think if you put it in a kit with a piece of saran wrap over it, you'd possibly spill on the way to the exam. But they just need to cover the bowl. That would be the only requirement. I got a question about applying protective cream on the hairline, base, and scalp. It's a non-base relaxer. They're just going to apply protective cream around the scalp, the hairline, actually. I have a question on the application of the relaxer. The best place to find the application of the relaxer would be in the textbook. But yeah, they do a middle shaft. They would apply to the scalp and the ends and demonstrate smoothing all in that one task. Where can the candidates dispose of the hair after the haircut? There are trash cans at the site. They also have a trash container that they bring. Either one of those is appropriate to dispose of the hair. We'll take a 5-minute break and come back, and we will present electrolysis, and that will be the final section that we're presenting today. So if you instruct in electrolysis, we welcome you to stay on board, and we'll talk to you in 5 minutes.
Thank you for joining us again. We're going to be talking about our electrology exam. Our candidates are in place. They'll be given the following information for the setup and client protection. You will now set up the supplies and the equipment you will use throughout your examination. You will also set up galvanic supplies. You will be observed for client protection, safety, and infection control procedures. You will have 15 minutes to complete this section. You will be informed when you have 8 minutes remaining. Step back to indicate you have finished this section. Instructions are repeated. The candidates are told you may begin your setup. Your examiners are looking to see that they set up disinfected and or disposable implements, that they re-sanitize or put on protective gloves before touching their model, that they select a work area on the model's arm that is free of lesions, rashes, or infection. And then we want to see that candidate sanitize the work area on the model's arm safely. They'll be placing an electrode on the model or in the hand so that it comes in contact with our model's body. And they will select a needle or probe that has the same diameter as the hair that is about to be removed. They certainly need to practice infection control procedures safely throughout the setup and the client protection, and maintain that work area in a safe manner throughout the setup and client protection. Basically, if they spill something, they need to clean it up. If they drop something, they need to pick it up. Then they'll be given the following they will hear the following verbal instructions once that time has lapsed. All candidates have indicated they've completed this section of the examination. We will now proceed. Our first method of hair removal is by way of galvanic. It is a 15-minute procedure. Candidates are told, you will now perform the galvanic method section of this examination. You will have 15 minutes to establish a working point. When the time has elapsed, the examiner will instruct you to remove 3 hairs. You will be observed for client protection, safety, and infection control procedures. You will have 15 minutes to establish a working point. You will be informed when you have 8 minutes remaining. The instructions are repeated, and the candidate is told, you may begin. At the end of that 15-minute period, and they will wait that 15-minute period, when the timer goes off, our proctor or examiner will say, please stop working. And then to each candidate individually, they will walk up to that candidate and say, please demonstrate removing 3 hairs. They will be observing to make sure that they put those hairs out on display for the examiner. That should be on a piece of cotton or a piece of gauze. Then the following instructions will be given. You will perform the thermolysis method section of this examination. You will have 15 minutes to establish a working point. When the time has elapsed, the examiner will instruct you to remove 3 hairs. You will be observed for client protection, safety, and infection control procedures. You will have 15 minutes to establish a working point. You will be informed when you have 8 minutes remaining. The instructions will be repeated. They are, and the candidate is told, you may begin. At the end of that 15-minute working point, or point where they're reaching their working point, when the timer goes off, our proctor will say, please stop working. Then that candidate will be told, please demonstrate removing 3 hairs. They will remove those hairs, certainly making sure that they don't injure their model that with the tweezers. We'll be looking to see that there's no blanching of the skin, et cetera, that true electrolysis is being performed. Our next section is the blend method. It too is a 15-minute section. They'll be given the following information. You will now perform the blend method section of this examination. You will have 15 minutes to establish a working point. When the time has elapsed, the examiner will instruct you to remove 3 hairs. You will be observed for client protection, safety, and infection control procedures. You will have 15 minutes to establish a working point. You will be informed when you have 8 minutes remaining. Instructions are repeated. That candidate is told, you may begin. At the end of that 15-minute time period, the candidate will be told, please stop working. The examiner will then say, please demonstrate removing 3 hairs, and they will remove 3 hairs by utilizing the blend method. Here again, making sure that they don't harm their model, and they place those hairs out for inspection. Our last is the conclusion of the service. It's 10 minutes. Candidates are told, you will now perform the cataphoresis and final cleanup section of this examination. You will be observed for client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. The instructions are repeated. Then our candidates are told, you may begin. We'll be looking to see that cataphoresis is applied over the work area using gauze or cotton or gauze as a barrier on the arm safely. Here again, it will need to be dampened. Shouldn't fall into the floor and cause an unsafe work area. The work area on the model's arm has been sanitized safely after the service, and that any used needles or probes are safely discarded in a labeled Sharps container. We will be expecting that candidate to dispose of any soiled materials using infection control procedures, as well as dispose of items to be disinfected in the proper receptacle. If you have questions, you can write us here at nancy.harlow@dca.ca.gov. We will be waiting for 5 minutes, and we'll be answering those questions. We'll be taking a break, compiling the answers to your questions, so give us a shout out here at nancy.harlow@dca.ca.gov.
We'd like to thank you for participating in the California NIC examination webcast today. You can still, if you have any questions, email them to nancy.harlow@dca.ca.gov, and we'll get the answers to you as soon as possible. But again, we certainly appreciate your participation today. Thank you.